Good evening, everyone, and welcome. I'd like to call to order this July 13th, 2020 study meeting of the Bloomington City Council. We have 4 items on the agenda this evening, and we will start with item 2.1, which is a public health proclamation. And as we've talked before about a number of different things. We've been following the guidelines from the Centers for Disease Control and the Minnesota Department of Health regarding the use of face coverings in enclosed facilities. And while the CDC has been recommending that people wear cloth face mask coverings in public settings and when around people who don't live in their same household, especially when social distancing is tough to apply. And Minnesota Governor Tim Walz, he's also strongly encouraged Minnesotans to wear a manufactured or homemade face cloth covering when they leave their homes and travel to any public setting where social distancing measures are difficult to maintain, for example, grocery stores or pharmacies and so on, and to follow face covering guidelines issued by the Minnesota Department of Health and the Centers for Disease Control. And based on the Department of Health and the CDC guidelines, and with the support of the city's Public Health Division, I'm going to ask the city's residents and visitors to join me in wearing a cloth facial covering when in indoor public settings. And in consultation with the city's Public Health Division and the city manager, I have requested that cloth facial coverings be required for anyone visiting indoor city facilities unless otherwise not recommended or exempted. And disposable facial coverings and hand sanitizers, as you know, are available at any of these city facilities. I want to state this is not an emergency proclamation or emergency regulation, but it is pursuant to city code or city charter. So in short order, making the proclamation that we're going to require them in city-owned facilities, City Hall, the Ice Garden, anything where you're indoor within the city of Bloomington. And we will discuss, I think, at our July 27th meeting, a question whether or not to require them or mandate them citywide, although I suspect, and frankly I hope, that we're going to be hearing from the governor's office before too long on this, where there will either be a statewide or at very least a region-wide mandate for facial coverings. So what I'd like to do here, read the proclamation and make sure that we have it officially in the record. This is a proclamation. Whereas Governor Wallace has strongly encouraged Minnesotans to wear a manufactured or homemade face cloth covering when they leave their homes and travel to any public setting where social distancing measures are difficult to maintain, and to follow face coverings guidelines issued by the Minnesota Department of Health and the Centers for Disease Control and Prevention. Such face coverings are for source control to help limit the person wearing the covering from infecting others. And whereas public health experts are increasingly urging the public to wear cloth face coverings to help curb the spread of COVID-19 by preventing the transmission of respiratory droplets that contain the virus. And whereas public health experts have advised that it is possible to transmit COVID-19 even before a person shows symptoms. And whereas public health experts have recommended that the use of face coverings may reduce the risk of transmission by an infected person as a component of multiple preventative measures for physical distancing, hand washing, and other prevention measures, understanding that face coverings are not recommended as a replacement for these actions. And whereas on June 28th, 2020, the CDC stated the following. First, CDC recommends that people wear face cloth coverings in public settings and when around people who do not live in your household, especially when other social distancing measures are difficult to maintain. The second point, cloth face coverings may help prevent people who have COVID-19 from spreading the virus to others. Third, cloth face coverings are most likely to reduce the spread of COVID-19 when they are widely used by people in public settings. And fourth, cloth face coverings should not be worn by children under the age of 2 or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Now therefore I, Mayor Tim Bussey, do hereby proclaim, strongly encourage, and call upon all Bloomington residents and visitors to join me in wearing a face covering over one's nose and mouth in accordance with the state and federal guidance as a measure to help protect ourselves, our loved ones, and our community from COVID-19 while in indoor public settings. And I do hereby further proclaim that the use of cloth facial coverings over one's nose and mouth is required as a measure to help protect ourselves, our loved ones, and our community from COVID-19 when inside City of Bloomington facilities unless otherwise exempted or not recommended by local, state, or federal guidance. This is dated this 13th day of July 2020, signed by Mayor Tim Bussey. So, as I said, we're moving toward the use of cloth face coverings in all city-owned facilities. And as I mentioned, we'll be having that discussion at our July 27th meeting as to whether or not to mandate it citywide. But again, hopefully Governor Walz will issue at the very least a region-wide, but hopefully a statewide proclamation mandate of masks moving forward. Council, any questions on that? Mr. Manager, anything to add?
No, Mr. Mayor, nothing to add on that particular note. I would ask, though, that before we get further in the agenda, if you would have the secretary take the roll for the meeting.
Oh, my bad. I forgot to take the roll. I apologize. You're all sitting here in front of me. I didn't even think about that. I apologize. Ms. Christensen, would you please take the roll call?
I sure will. Thank you. Councilmember Beloga?
Here.
Mayor Bussey?
Here.
Councilmember Carter? Here. Councilmember Coulter?
Present.
Councilmember Lohman?
Here.
Councilmember Martin?
Here.
Councilmember Nelson?
Here.
Let the record show that all 7 members of the Bloomington City Council are present, either in person or via WebEx. Thank you for the reminder. Appreciate that. Councilmember Lohman, a question?
Yeah, I'm not sure if we've approved the agenda for today, but I wanted to see if we would consider a switcheroo with the 2.3 and 2.2.
I think with the presenters that we have lined up, and we have other presenters along with Chief Potts, I think it might be best to leave the order as it is now. Obviously, they're tied closely in a number of different ways, but I think it would be best if we leave it in order based on the external speakers that we have lined up to speak tonight.
Go.
Okay. Any other questions, Council? With that, I'd like to call item 2.2 in our organizational business. It's a continued discussion of police practices. And we've got with us again this evening our Chief of Police, Jeff Potts, and Josh Seifert. Chief Potts, are you with us?
Yes, Mayor, I am. Thank you for having us back here tonight. We're going to try to do a presentation in a couple of different segments. I have 2 of our staff, as you mentioned, Officer Josh Seifert and also Sergeant Cullen McCarg, who are going to assist me tonight. They're going to cover the segment that is related to our policy 101 on police use of force, or as we call it, response to aggression and resistance. And this is, again, a continuation of the discussion that we had back on June 22nd. I want to start with just a couple more things that we talked about quite a bit that night, and I've gotten some questions as Chris is pulling up the presentation here, questions related to community engagement and kind of specifically, what is the Bloomington Police Department doing to build relationships in the community with all of our community? How are they, what does the work look like that they're doing to try to build trust and transparency in the community? And so I wanted to hit on a few more parts of our community engagement strategy, but also talk a little bit in detail about some of the things that we have been working on very hard since May 25th, which of course was the date of the tragic death of George Floyd. Chris will be our slide handler here. Chris, could you move to the next slide, please? Community engagement in the police department involves a lot of different things. Now, we really committed to this about 3 or 4 years ago in terms of our programming. You'll see on the screen a number of different community engagement activities that we do on an annual basis, and we're always adding events to it. I'm really quite proud of a few of the things in here that I think that our U.S. council members in the community should know about, particularly the neighborhood watch groups. We have a crime prevention coordinator, Katie Zurell, who manages over 400 individual neighborhood watch groups that we interact with on a regular basis. We send crime alerts. We communicate with them on a variety of different topics just to help build community and keep them aware of what's going on in their neighborhoods. The National Night Out, unfortunately, because of COVID, we had to postpone that to later this year. But traditionally, we hold, or we in the neighborhood watch groups host over 435 individual block parties throughout the city. That is a very special night for the Bloomington Police Department and the community, that we send an individual representative from public safety, primarily the police department, the fire department, Alina, out to every one of those parties, or as many as we can physically get to. And in council, you normally are out there with us, so you know how busy and hectic that night is. But we try to interact with as many of those 435 individual parties as we can. And we think that that's an excellent opportunity for us to get to know our community better, for us to try to kind of get out and talk about public safety issues that we are aware of throughout the community, but really encourage the neighborhoods to come together to get to know each other. We think that's one of the best crime prevention strategies, is that when the neighborhood knows each other and they interact with each other on a regular basis. And we're very committed to doing a National Night Out event this year. Unfortunately, we had to postpone it for a few months. I'm going to touch on the events that are in yellow on the slide, and I'll get to the reason why in a minute. During COVID, we started doing these birthday and special event parades as a way to continue with our community engagement efforts in a time when, as you just mentioned, Mayor, with the mask policy, which I'm in my office all by myself, so I assure you I am not violating that particular rule at this time as I speak to you as a council, but we recognize the danger of close interactions with the community. And so what we had started to do was go out and interact on these birthday and some special anniversaries, other kind of special events in the community with a parade of public safety vehicles, sometimes fire department, sometimes the sheriff's office would join us. And we've continued to do that during COVID. The other item on the far right are these neighborhood/park stops. These are what we encourage our patrol officers to do on a day-to-day or night-to-night basis. This is how, when they're in between calls for service and when time permits, we encourage them to stop and talk to residents out on their block, people in parks, people out in the community where there's opportunities for our officers to have a positive interaction with them. And we capture some of those in our CAD system, but on the top of the screen, you'll see there's 148 events in 2019 that come from this list. And we don't capture every single time an officer stops his or her squad car to have a conversation with the community. That's something that we're working on to give you a better and more accurate reflection. But those highlighted items in yellow are things that occur in the neighborhoods. If the community is wondering what are the officers doing and specifically directly focused in the neighborhoods, those are the items. Now, all those other items listed in white are other programs that we have either been doing for several years, or some things that we're more recently, like the events at ethnic restaurants. What we realized was when we did traditional coffee with a cop, that we would see a lot of the same faces, which we were very happy to see those residents, but we weren't seeing a lot of diversity within the crowd. And we wanted to take those events to places where we could potentially see a more diverse audience, a more representative audience of the city of Bloomington. And so that is something fairly new that we just started in the kind of the second half of 2019. And as soon as some of the COVID restrictions lift, we fully intend to start doing that again. Safe Summer Nights. I think many of you as council members were at those events that we've had for the past few years. We usually do that at Valley View Park. We invite the neighboring neighborhoods all around Valley View Park, and we also send invitations out to the school district. And we bring out some of our law enforcement equipment. We bring out park and rec equipment, and we have a good old-fashioned kind of party in the park with our neighborhood. We provide food and water. We have, like I said, a bunch of games for our officers to actually play the games and interact with the kids in the community. It is a very well attended and a very positive event when we're able to do it. Now, of course, again, COVID has put us, we're having to postpone a little bit. On the right side, you'll see Shop with the Cop. That is at Christmas time. We partner police officers with youth in our community who have experienced some type of very traumatic situation or just are very unfortunate in some way. And our officers will be partnered with them and go out and Christmas shop, not only for the child, but also for their entire family. And we do that through donations that we receive throughout the year. A very similar program called Holiday Helper in Blue. I misspoke there. Holiday Helper in Blue is the Christmas event. Shop with the Cop is an event that we do just before school starts. Both of them are very much the same in that we help provide the child with the funds to go out and shop for either school supplies or Christmas gifts for their family. Serving lunch in the public schools, we do very regularly. Our officers in crime prevention and patrol officers, as well as even investigators, will go out and pick a particular school, and they'll get a chance to serve the entire school lunch on a particular day. We try and rotate through all the schools. We run a 10-week Citizen Academy. We've been doing that for over 20 years. It's a really good opportunity for our residents, for those who either work or live in Bloomington, to get a really close-up view of the work in the Bloomington Police Department. Like I said, it's 10 weeks long. It's 3 hours a night on Thursday nights. And by the end of it, the graduates, and again, there are 30 of them every year, who walk away really much better informed, but also a much deeper relationship with their police department. We do a senior academy for our senior population. That's not 10 weeks. That's a 5-week academy that we do during the day. Again, trying to focus on building relationships, but also providing information that is helpful to that particular group of people. There are a lot of scams and other crimes that are directed at our senior population. There's a lot of crime prevention tips and techniques that we can share with them. And so we have begun annually developing programming specific to our senior population, and we will continue to do that. The last item on the list is our MAC meetings. That's our Multicultural Advisory Committee. We meet with them monthly. That is part of our JCPP program, which we talked somewhat extensively about back on the 22nd. But I just want to again point out that we look to those MAC members to be advisory to and also help us when we are looking at policy, for example, or new programs, that they represent the community. They represent certain ethnic groups within the community, and we look to them for feedback as we roll out new programs. And again, we meet with them on a monthly basis. They also, the MAC members also participate in just about every other event listed on the screen. They are usually volunteering to help us out or actively participating in somehow in those events, and we really appreciate their help. Okay, Chris, you can go to the next slide, please. And so since the again, tragic death of George Floyd, we have been listening to the community a lot. We've been looking at the work that we do. I would say that we're very engaged in trying to figure out ways that the Bloomington Police Department can demonstrate to our community that that we are, again, taking this issue seriously. And I want to highlight a few things that, again, maybe you all know about, or maybe you don't, but also that our community, for those who are watching tonight, to demonstrate that since May 25th, we haven't just sat back and said, hey, we're good. We think we're doing everything just right. We've actually listened, and we've made these changes and commit to working even more in the future. So the first thing you see is the Bloomington Police Department Policy Manual is now available on the PD website. From a transparency standpoint, that was a important step, I think, for our, not that we were hiding our policy manual, but what we had heard is that there are a lot of people who wondered what was in our policy manual, how those policies were worded. And so we very quickly worked with our staff here within the city communications department, IT department, and we were able to put that on the Bloomington Police, or on the city website on the police department page. Also, to demonstrate transparency and, again, make it easier for our community to access information and access the police department, we have now moved our complaint form and complaint process to the police department website. If an individual has an encounter or is aware of an encounter with the police department that didn't go the way it should have, we now are going to be able to provide an opportunity, an easier opportunity for folks to let us know about that. We had, and I'll talk about a series of listening sessions here where we heard about this, but we even accept that form online anonymously, and our professional standards division will look into every single one of those complaints that we get. Again, in the interest of being transparent and also making it easy for our residents or for those people who come in contact with Bloomington police officers, we felt that that was the appropriate thing to do in terms of making it easier for people to let us know when an experience didn't go the way they thought it should. We implemented a duty to intervene policy via administrative announcement. That obviously was something that was talked a lot about in the wake of the death of George Floyd. And so that has been done. Evaluating, we are currently, and we're going to talk more in depth about this here tonight, but we're evaluating our response to aggression and resistance policy, commonly referred to in police departments as a use of force policy, although that's changing as more and more departments kind of adopt this new kind of vernacular as it relates to use of force. And that's what, again, what we're doing here with you tonight. We're going to give you some information directly from our response to aggression and resistance policy, and we want to get your input on that. We plan to continue to seek input on that. You'll see on the lower part of the screen where we've conducted listening sessions with our African American community leaders, our Latino community leaders. We've met with multiple times. We're doing all of this through WebEx or through Zoom, through electronic kind of virtual meetings. And we also have an upcoming meeting with our East African community leaders here in Bloomington. And this is one of the topics that we are seeking input from them and other groups throughout the city, just to make sure that everybody is aware of what our policy is, the kind of the finer details of it. And after collecting that input, we'll figure out, are there some changes that need to be made based on that input? And so we start that process. We've essentially started that process within the last weeks, but tonight's presentation with you is really a big step in that direction. The other thing on this screen is our data collection efforts. This is a project that we are currently assessing all of the types of data that we collect and trying to figure out, are there ways that we can utilize that data differently or in a more transparent way. So right now, I know the city manager, Faith Jackson, our racial equity coordinator, and I have already had some conversations, and there will be additional conversations about trying to figure out, what is the important data to collect as it relates to the work that the police department does. And then how do we disaggregate that by race? And in what cases do we have the current capabilities to do that? One of the things that we hear about quite frequently is you have race data on traffic stops. And one thing that makes it very difficult is that the Minnesota driver's license does not capture race data. And so when the officers interact on the street and they swipe the driver's license and ultimately either issue a citation or maybe just a verbal warning, that data is not collected through the Minnesota driver's license. And so if we're going to go about collecting that data, we have to figure out a reliable and accurate way to do that. And again, these are the types of conversations that we're having so that we can be, again, transparent with our community about the work that we're doing. Again, I alluded to these listening sessions. These have been very informative. I have participated myself in nearly all of them. There was one of them that I was not able to make, but Deputy Chief Mike Hartley was there. And we're hearing some interesting things, and these listening sessions have been really just that. It's an opportunity for folks to ask us a lot of questions, maybe even share some frustrations, their concerns. We get questions that indicate that sometimes people feel like they're stopped based on the color of their skin. They're concerned about racial profiling. We have heard that there are people that may be afraid of what might happen if they get pulled over. And particularly, we hear that from our BIPOC population. And so we're doing a lot of listening and answering some of the questions. You'll see on this list, this slide that you're looking at, we'll make changes and improvements along the way. But we also are listening in especially as a question like, I'm afraid of what might happen if I get pulled over. And so I just had a conversation with co-ed today about trying to figure out if there's ways that we can talk to our community about what a traffic stop should look like and how that should go. What kind of information can we share? And I know that the Department of Public Safety over the weekend just released a new driver's license or driver's education materials that now includes what a driver, especially a new driver or a new American driver, can expect when they get pulled over by law enforcement. And it provides the new driver with information. We think that there may be ways for us to replicate something like that with our communications department here in Bloomington. And we have a video that's already been done on that, but we might be able to, again, add to that and make it even more clear. But that's just one of the things that we're hearing by doing these listening sessions. There's been a lot more, I think there's been a lot of information exchanged and conveyed to us. And I think what we're doing at the same time that we're listening is we're slowly building that relationship and building a deeper level of trust. There's more transparency, and that is something that we obviously are committed to continuing. We have, as I mentioned there's a upcoming meeting with the East African community leaders, but I think we're also planning to continue with the community leader meeting with our African American community and our Latino community leaders. That's not just a 1 or 2 meeting thing. That's something that we want to do on a regular basis. So with that, I would like to yield to any questions that one more thing. I know I got a question about this at the meeting on the 22nd, and that is, tell us a little bit about your response to the mental health issues that you're dealing with. And there was one question about the social worker program. So we are just barely a year into this program. And what we have seen is the ability from a social worker internally or embedded in our organization can more quickly and more efficiently engage with folks who need mental health services. And because of that, the volume of work that's being directed to that particular employee is quite high, and we're going to closely monitor that. Now, if we get to a point where we figure or feel that that's not sufficiently handled by one employee, that's about a $60,000 a year commitment to do each embedded social worker. But I don't want to speak too soon and say that, hey, we need more of these. We are really trying to analyze what we've done over the first year. We're trying to figure out what kinds of things can we do differently to make their time and maximize the value of the social worker time, but also at the same time, see if there's ways that we can engage Hennepin County and their network of social workers in a way that helps us meet our demands here in Bloomington in a better way. And anecdotally, over the first year, we have had situations where our social worker has engaged with individuals who have had ongoing amounts of crisis in their life for sometimes 20 or 30 years and have never been able to really make a meaningful step forward to stop that, or to ultimately kind of get the treatment and other services that are needed to help reduce that. And our social worker has been able to get them to successfully engage with the Health and Human Services Division and receive services. And some of them we now haven't had contact with 3 or 4 months, where we were having weekly, if not monthly contact. And so there are a whole bunch of stories like that where early engagement with those individuals with the right resources, which is what our embedded social worker has, we think will make huge differences in the lives of some of the folks who have been living in Bloomington who may not have had access to those services in the past. And so I know that was kind of a quick add-on to the presentation, but I did get asked about that at the last meeting. And I just want to clarify kind of where we're at on that embedded social worker program. Mayor, with that, I'd like to pause and answer any questions relative to the community engagement and some of the recent improvement or actions that we've taken. And then after we've taken those questions, we can move to the presentation by Sergeant McCarg and Officer Seifert.
Thank you, Chief. Council questions. I saw Councilmember Nelson and Councilmember Coulter with their hands up. Councilmember Nelson.
Thank you, Mayor, and thank you, Chief Potts. I appreciate your time again this evening. And the first question I have, you talked about the community engagement. Do we assign officers based on geographical areas so that they would have multiple contacts within the same area, so people would get to know maybe the officer that patrols their area or would be in their area, or do we not use a system like that?
Chief Potts.
Mayor, Councilmember Nelson, the answer is we do have the city broken down into 5 geographical areas. They are essentially the area east of Portland. That is one area. Between Portland and Penn, north of 90th, is another area. Those same north-south, so Penn and Portland to the south of 90th, that's 2 more areas. And then the west side is broken down into basically everything north of 98th Street is one, and everything south of 98th. Now, officers do have the ability to bid their shifts on a trimester basis. This is long been the practice, and we see officers who routinely pick or bid the same neighborhood, the same area, because they've gotten used to the kind of the activity within that geographical area. They know a lot of the people in that area. It's beneficial in so many ways. Now, that isn't universally true, but that is very common that the officers get very familiar. And believe it or not, the officers can actually get really familiar with multiple areas. Say for example, the area in the center of the city, we call that the 2 area and the 3 area. An officer can move between those 2 areas and still build very deep relationships. But the short answer to your question is yes, the officers do get very familiar with the neighborhoods, and they bid those areas frequently over and over again for several years in a row.
Thank you. I appreciate hearing that. My second question relates to the relationship with the county. And one of the things that I've heard from the community is, would there be opportunities for maybe more of a mental health professional to go serve people? And I'm not sure that a lot of people in our community are aware that currently Hennepin County has crisis lines for adults as well as youth. If they don't feel like there's a reason to call 911, there's not an imminent emergency, that you can call the county and have a mental health professional come out and help with that. And so I guess some of my question is, how do we interact with that group? And is my information that I'm sharing there accurate? The second question is, if somebody called in and that seemed like the more appropriate avenue, does our dispatch have the opportunity to share that information and get them in touch with that group? Or how does that work?
Chief.
Yes, Mayor, Councilmember Nelson. So you're asking a really deep question there. The Hennepin County does provide crisis services. As you mentioned, they're oftentimes done over the phone. Hennepin County, in our experience, rarely will respond to a residence as a crisis is unfolding. And so normally the call to the Bloomington Police Department is there's a crisis and they want some type of a response to calm the situation down. And so what we oftentimes will do in that is we will send police officers, because there isn't another option from Hennepin County. Although they have a what's called COPE, they typically don't respond to the crisis as it's unfolding. But when our officers are there, they'll give a referral to Hennepin County Crisis and Hennepin County Health and Human Services. But also, because we now have an embedded social worker, we can make that connection very quickly to our social worker to get them connected to the appropriate service provided by Hennepin County. There's a long list of options in the Health and Human Services portfolio. And the benefit of the embedded social worker is that they have access to all of those. I will say that one of the things that we are looking at and considering in partnership with either Hennepin County Health and Human Services Division, or even some other police department, and that is this idea of a co-responder model. That would be where you partner a police officer with a mental health professional, and they would then respond to the crisis call together. Now, we opted for the embedded social worker as step one because the volume of calls and the frequency of the calls, although on an annual basis they're quite high, in the close to 1,000 range on any given day during a shift. Our concern was that you wouldn't have the call volume to keep a co-responder model busy in just Bloomington, but we can keep an embedded social worker very busy, as I mentioned a few minutes ago. So we're going to continue to look at this co-responder. The model that I think could potentially work is if we somehow regionalize that, some of our neighboring agencies or the sheriff's department, where that would be a resource that would obviously be able to respond to calls here in Bloomington, but also maybe one or two other cities, and creating kind of a region. And then that would be the unit that could be sent to these crisis calls. But for right now, it's our police officers, again, with the assistance of our embedded social worker as kind of a resource, but also Hennepin County and our officers know the services that they have so they can make referrals once they're at the house and have kind of calmed the crisis down, at least for the time being.
Thank you, Chief Potts, for that information. And yeah, it was my understanding that our officers are able to respond professionally to immediate crises. The Hennepin County services would maybe be by phone or something less imminent, where there was, they may be able to respond the next day or something of that nature. In terms of the regional, just one quick thought is how that might interact with our public health department, which does cover Bloomington, Richfield, and Edina, and how we could work with them. But in general, that's all the questions I have on this part. So thank you very much for your time.
Councilmember Coulter.
Thank you, Mr. Mayor. Thank you again, Chief, for being here and for answering the questions. One thing that I did notice as you sort of detailed your efforts, and I am impressed. I think they are extensive. It did seem to me that a lot of the community engagement efforts that you talked about are sort of police, our department initiated and organized events where, essentially folks come to you, which I think would certainly explain why you tended to see a lot of the same folks over and over again. And I'm wondering if you could detail your efforts to sort of go in the other direction, any outreach that the department has done to, other groups or organizations to sort of, we want to come talk to you. We want to come to you and give you a question to, or give you an opportunity to sort of ask us questions and things like that.
Sure.
Chief.
Mayor, Councilmember Coulter. So in that slide, I highlighted in yellow those that are really us going out into the community, the neighborhood and park stops where we encourage our officers, where it's not a formal, on a calendar kind of event, but where they see folks in parks or, like I said, in the neighborhoods, they stop and talk to them and really listen to what our residents have to say. Quite honestly, we frequently hear that our residents just want to talk to officers to kind of hear what's going on in the neighborhood and talk about what particular types of incidents or events may be reporting. Just before we actually did it in March, but just before we really got stuck into the COVID situation, I had begun a monthly conversation where we were moving through the geographic areas through the city that I kind of described when Councilmember Nelson asked the question. And our plan was to hit every geographical area at least twice during the year to really go out and just have conversation and listen to the community, kind of what you're suggesting, I think, which is not to take a program to the community, but really to go out and listen to the community. And so we've kind of replaced those with these conversations, these listening sessions that we've started through WebEx or through Zoom. But we fully intend to get back to going out and on a monthly basis, meeting with the community in the various neighborhoods and patrol districts throughout the city to really just hear what they have to say. And, again, with 420 some neighborhood watch groups, we feel we've kind of developed partnerships with that accounts for about 20,000 of our residential units throughout the community. But there's still more work to be done. And I guess, I remain committed, even though we're in kind of a virtual setting here, that we can still do these listening sessions or these making these connections in the community during COVID. But that monthly listening session, we were really excited about because we wanted to move all throughout the community to really hear what the concerns are. And the one that we did have, it was the first one. We still had 30 or 40 residents show up. And so it was well attended. We marketed it on our Twitter page and Facebook, social media. So we know that there's an appetite for that kind of a setting and that kind of interaction with the police department, and we're going to continue to do that.
Thank you. That's good to hear. And I guess I would just kind of encourage you to think creatively, think beyond sort of the neighborhood watch groups. I know, for example, we all received an email letter just not too long ago from various faith leaders looking to engage in the conversation on policies and procedures. And so I just kind of want to encourage you to think creatively about the folks that you're engaging and how you're doing that. I know you appreciate the need to not hear just from the same people over and over again. So I just want to make sure that we're not sort of resting on our laurels in that regard.
Mayor,
Chief?
if I may, I'd like to respond because I think Councilmember Coulter mentioned an email that I was also copied on, and I should have added that to the list of things that we're working on. But based on the information that we received, I believe it was the same group and maybe even the same email you're talking about. Just today, I had conversations with the police department's representative from COED, Amanda Crombie, about trying to figure out how we could facilitate a meeting or a WebEx with members from that group. So you're spot on with what we're thinking in terms of getting creative and moving beyond just what I mentioned in terms of neighborhood watch, we will continue. But if you have other ideas or suggestions, please don't hesitate to send them my way, and we can have our staff look into how we can make those happen.
Thank you.
Councilmember Carter.
Thank you, Mayor. And I want to echo my thanks to you, Chief Potts, for all that you're doing, and for just being really open and receptive to continuing to make sure that we have, the best possible policing going on in Bloomington as possible. And so I had a similar question as Councilmember Coulter, but I had an additional point that I wanted to make. So I asked about data in our last city council meeting, and I understand that it's kind of challenging to pull together a comprehensive view of the data that is kind of fair to the broader context. And so I appreciate that there is more conversation going on about how to really make sure that we're capturing meaningful data, where we can disaggregate by race and ethnicity. And I just want to emphasize how critically important I believe it is, because I feel like it's where we can, identify where we're doing really well, but also figure out where we have gaps and opportunities. And again, I understand that the context is so important. For example, I know that there's, officer initiated arrests or stops, but then there's also just the fact that they're responding to a lot of calls, and those are kind of out of their hands. And so I really look forward to having the conversations around data, with the appropriate context around those. And in addition to considering what we're hearing from our community members. And then I guess my question is related to community engagement. I'm curious to know, what you see as one of the biggest challenges to doing community engagement from the police officer perspective or from your perspective, and if there is a way that, council members can be helpful. I know that it's kind of a tough nut to crack. And so I'm curious to know where you're experiencing the greatest challenges and maybe where we have opportunity to do better.
Chief Potts.
Mayor and Councilmember Carter, I would say probably the biggest challenge for the community engagement work is making sure that the officers have the time. So as I mentioned before, there's really two types of community engagement. One is a list of programs that we've kind of created internally through our crime prevention unit or our JCPP community liaison works very hard to plan those events. But that interaction in the neighborhood or in a park, we rely heavily on our patrol officers to do that. And so that only works when they're not running call to call to call. And so part of the challenge is just making sure from a staffing level that we can stay at a level where we have what's called some uncommitted time during the course of the patrol officer shift, because frankly, in some communities where they really, I think, hurt as an organization is they don't provide enough uncommitted time for the officers to interact with the community, and they end up just going basically from one call to the next, and we don't get that chance for that kind of, that non-enforcement encounter, which is really important and really valuable to both the officer and the members of our community. And so that's the one thing I would say is that just making sure that we can maintain a level in terms of staffing that we can provide our officers with an appropriate amount of time to be able to do that during the course of each and every one of their shifts.
No follow-up
Thank you.
questions or comments, so thank you.
Additional questions, Council? Chief, I did have a question, and I think it's somewhat related to the question Councilmember Nelson, as he was, I think, kind of walking up to the notion of a beat cop model. And I know it's difficult in a suburban community, much more difficult than it is in an urban area or a downtown area. But I want to hear your thoughts on the elements of beat patrol, getting that used to an area where you're very well known, and you know the people you're working for, and the people know you very well as if you're an officer, and not only with the residents but also with the business owners. And I know the Bloomington Police does quite a bit with the Bloomington business community and through the chamber and so on. Just wanted your thoughts on some of those ideas, and just the idea of getting officers out of their cars more often, trying to connect individually, whether it's a bike patrol. The city manager said I couldn't bring up horses, but I think horses are the best way in the world to get people out in favor of the cops. But what are some of your thoughts on getting out of the cars, a beat model, just trying to be that ingrained in the community that, as you said, it's not just a specific event, but it's actually part of the day-to-day work that officers do?
Yeah, Mayor, I think you'd actually be surprised at how much of that actually happens in the pride that the officers take in those relationships that they build in the areas in the specific geographical areas that they work. One of the points I think I want to kind of reiterate is the ability to do community engagement work is really driven by a couple things. One, it's how many officers, what's the call activity, and how many officers do we have working so that that call activity can be spread out, and allow officers to interact. The horse patrol or the bike patrol. Actually, we have tried both of those here in Bloomington. Believe it or not, we had a horse patrol back in the 80s, and we had a bike patrol in the 90s. And while they do provide kind of an alternative to a squad car, they both for this, the makeup of Bloomington and the way our city is kind of laid out, they didn't work as well as we had hoped. As you commit someone to a bicycle or to a horse, you uncommit them to a timely response to an emergency call. And so as we always are trying to balance the right response time to all members of our community in the case of an emergency, but at the same time, allow our officers flexibility to go interact with the community. Oftentimes what that means is we find ourselves wanting to keep that officer pretty close to the squad car so that if an emergency call comes out in that area, they can get to that quickly. And so it's a little bit of a balancing act as to how do we put the officers in a position to really get out and interact with the community in non-enforcement settings, but at the same time, sufficiently staff the city in a way that we can have a timely response. And so we're constantly looking at that. We're constantly looking at ways that we can, in that list of community engagement activities that I showed you just a few minutes ago, has grown. And so that really is, kind of the byproduct of these discussions and trying to bring groups of the community together where the officers can go during their shift and meet a large group of them. And we're continuing to look at new, more innovative ways to do that. And our officers now, and the annual evaluation form, it's become a area that they are rated on annually. It's to kind of demonstrate the commitment from the organization to doing this work. And that it's to the level where at the end of the year, there's a conversation with all the officers about what their individual commitment to this type of work really was. But at the same time, have monthly conversations with our officers to try and figure out what are some new ways, just as you suggested. Maybe it doesn't involve a bike or a horse, but how can we keep doing this work in a real meaningful way? And we're always looking for ways to get better at it.
Thank you, Chief. Councilmember Martin.
Thank you very much, Mayor, and thank you, Chief, for this information. This is really helpful. I guess if this is too in-depth of a question or need to discuss another time, I understand. But to the point of freeing up time for officers to engage kind of one-on-one with residents or out in those public settings, is there discussion within the department, or you anticipate there will be, about maybe division of labor between, say, our CSOs and our kind of fully fledged officers? I know across the country right now, there's a lot of discussion about, is an armed officer necessary for every situation, going from a traffic accident to, say, a mental health crisis, kind of all over town. Is that broader discussion about maybe putting more on the CSO's shoulders to free up our officers' time to be able to do that engagement, something we're looking at?
Chief Potts.
Mayor, Councilmember Martin, absolutely. In fact, just last year, we had that very discussion and expanded some of the duties of not only our CSOs, but even the police reserves when they're on duty, all in an effort to look for ways where we can, if as you say, it's not something that requires a sworn police officer, and it can be safely handled by a CSO or in some cases a reserve. We're always looking at what kinds of things can we move around to would ultimately, as you mentioned, free up more time for the officers to do some more of this, community engagement work. I will say that I'm really proud of the officers that that are here, and because they are very committed to doing that already. They're trying to handle their calls as efficiently as they can, but yet still do a very good job. You know, when that 911 call comes in and it's a report of a theft, or it might be even a more serious type of a call, that interaction is really important too. And we can't, you know, we have to provide the appropriate response. And I think that's, you know, that's an area, a particular area that I think our officers do very well, is make sure that when they do get those 911 calls or those police calls, that they're delivering a really high quality level of service. We're trying to find ways for them to be able to do that work as efficiently as they can. Most of the report work, for example, can all be done now in the squad car. It doesn't require a trip to the office and more time out of their patrol district. But they've really, you know, really bought into that, and, you know, continue to deliver high quality services to the calls for service, but also in between calls for service, make the most out of what might only be 10 or 15 minutes in a community contact. But to your point, yes, we are looking at what can we, you know, what kind of duties and functions can we slide around to make even more time available. We added to the list of functions that our CSOs and reserves do last year, and we'll continue to look at that.
Thank you.
Council, if there's no additional questions, I will ask the chief to move on, and we'll move to the next section of the presentation. Chief Potts?
All right. Sure. Thank you, Mayor. I'm going to ask in just a minute here, I'm going to swap places, and I'm going to have one of our training officers come in. But really what you're going to hear tonight now, Council, is a somewhat in-depth presentation on and hopefully what will lead to a little deeper understanding of the police response to resistance or aggression and resistance, commonly referred to as use of force. We have two individuals in our organization that are going to present to you tonight. They're part of our training team for this. We're fortunate to have officers who have either invested a lot of time, and much of it is their own time, to become very well versed in this topic. We have a 8 or 10 person training team that deals with this, you know, use of force or police response to aggression or resistance. But the two tonight are Officer Josh Seifert. He's a 20-year veteran of the Bloomington Police Department. He's been doing this type of training for 17 years. He's going to take you through about 2/3 of this. And then the last 1/3 or so is going to be Sergeant Colin McCarg. He's an 18-year veteran of the department, and he's been working in this type of training for 13 years. Both of them are not only trainers here within the police department in Bloomington, but they also do work across the state of Minnesota, and even in some cases in other states. So they're well known in this field. They've put a lot of time and energy into trying to make sure that they're staying as current as possible. And what they're going to share with you tonight is, again, our use of force policy. And then there was a lot of questions at the last meeting and since then through email about, you know, do the Bloomington Police Department use a chokehold or do we allow our officers to use a chokehold? And there's some confusion over what a chokehold is and what we refer to as a neck restraint. And so they're going to get into some detail about that, share with you some of our data about use of force data. Some of the data will, I think, be interesting, maybe perhaps as you see it, that it shows really as we develop a use of force program here, it's really built on a couple key things. One is making sure that our officers are using the appropriate tools and tactics, making sure we're using the least amount of force or force only when absolutely necessary. And I think what you'll find from the presentation tonight is through the data that our program here in Bloomington has been well put together. And again, we continue to make modifications as recently as last year, fairly significant modifications to make it even better. So with that, Mayor, I'm going to introduce the first speaker to come in here. That's Officer Josh Seifert. And again, he's one of our training officers, and he will take you through the first 2/3 of the presentation. So I'm going to step away, and you're going to see Josh Seifert here in about 5 seconds.
Good evening, Officer Seifert. Welcome.
Good evening, and thank you, Chief Potts. I'd like to take a moment to also thank the mayor and the city council for the city of Bloomington for inviting us here tonight, Sergeant McCarg and myself, to share some information with everyone. So I'll give a brief synopsis of the type of information that we're going to share with you tonight. Police response to aggression and resistance, and more specifically use of force. is a very complex topic when we're talking about how we as police officers deal and manage human aggression. So tonight, we're going to briefly discuss topics that will help you better understand some police use of force, but more specifically, Bloomington Police Department's response to aggression and resistance. And this will include recent Bloomington force data. It'll also include how we compare nationally. And then finally, some strategies and tactics. So on some subjects, you'll see us kind of hit the Reader's Digest highlights. Other subjects will spend a little bit more time on the data and some information. So let's start off first by just defining what is police use of force. So there might be some folks out there that you know, well, what exactly, when does it actually constitute force? Well, the moment a marked patrol car or a police officer in uniform shows up on scene, that can be basically considered force, just mere officer presence. The fact that there is more than one officer on scene oftentimes will reduce or eliminate the need to actually use force. A little bit further down the spectrum. So force isn't necessarily linear. You know, we like to say there's varying degrees of force. So very low, obviously, on the spectrum would be just mere officer presence. But it also includes any trained or untrained technique or manipulation and that is used on another, and for the purposes of control, self-defense, or in the defense of another or suspect. If you want to go to the next slide, please. So there are two types of force. There's non-deadly force and deadly force. And today, we're just going to focus on non-deadly force. Next slide, please. So obviously, here's a list of the legal reasons police use force. It is obviously not all inclusive. There are a variety of legal reasons officers use force, but some of them include to effect an arrest, prevent the escape of someone, self-defense, and that includes a member of the public, or to protect another officer, to prevent property damage, to quell a disturbance, service of a warrant, temporarily detain, prevent self-inflicted injury. That's actually some of our data that we've collected has shown that we, in the past few years, have used a little bit more force on folks who we actually never intend to take to jail, but are a danger to themselves or the public. So we put that in there to prevent self-inflicted injury as an area where it may be necessary for us to use force. And then finally, as part of the list, to carry out the order of a court. Next slide, please. So we talked about the reasons police use force. Well, how about when do police use force? And more specifically, when do Bloomington police use force? So here's some 2019 statistics. So in 2019, Bloomington police officers responded to a total of 46,239 calls for service. Of those calls, 90 responses to aggression and resistance reports were completed. That means there were 90 incidents of use of force. So what that boils down to percentage-wise is that 0.19% of the over 46,000 calls for service resulted in police use of force in the city of Bloomington in 2019. So basically 99.8% of police calls for service do not involve force. Now, this obviously does not include the hundreds of public contacts that officers have with citizens in Bloomington every day that aren't documented through our dispatch system. Okay. So of those 46,239 calls for service, there were 2,323 arrests. Of those custodial arrests, only 3.8% of those arrests force was used. So that means 96% of custodial arrests do not involve force. Next slide, please. So how does Bloomington compare nationally? So the caveat to this is that the Bureau of Justice Statistics performed a study in 2015 that was published in 2016. So it's a bit old, but it's the most recent data that we have that most closely matches the data that the force data that we collect. So in 2015, there were over 253 million people in the United States. And of that population, 21.1% of the population over the age of 16 reported having police contact. Of that over 253 million people, 1.8% reported force or the threatened use of force by police. So compare that to Bloomington's 2019 statistics. Again, we had just over 46,000 calls for police service, 90 responses to aggression and resistance, and again, 0.19% of police contact resulted in use of force. Next slide, please. So let's talk about de-escalation, because when feasible, we don't just resort to using physical force. Okay, we talked about officer presence. According to BPD policy and training, we use a variety of de-escalation strategies. The two most common that we use here in Bloomington are CIT, which stands for Crisis Intervention Techniques or Training, and LEADS, which stands for Law Enforcement Active Diffusion Strategies. And when I say when feasible, basically when time, distance, and cover is available to have that sort of conversation with the subjects that we are interacting. I'll give you an example of when de-escalation strategies just might not be feasible. Police responding to an active shooter at a workplace or a school where there is active violence occurring, or violence against an officer or another is imminent. The opportunity to use those kinds of strategies might not be feasible at that time. But when feasible, officers make every attempt to de-escalate and temper these events so that they don't have to use force. The goal of every Bloomington police officer is to safely and peacefully resolve the event. Excuse me. And if de-escalation efforts are not successful, Bloomington police officers are trained to use an objectively reasonable amount of force. Okay, next slide, please. So you're probably asking, what is an objectively reasonable amount of force? That comes from the case law Graham versus Connor, which I'll touch on briefly in a future slide. But we take in what's called the totality of the circumstances. So what that means is officers take into account a variety and a large number of variables into when they're going to use force and what type of force is going to be used. For example, these variables are different for every officer. Things they take into account are the environment. Are they dealing with the subject out on the ice and snow, on the pavement, on the busy highway on 35W or 494? What is the officer subject size differential? Is the officer much smaller than the subject? What is the officer's fitness level and skill level? What is the duration of the encounter? Was the encounter preceded by a foot pursuit? And are there additional officers present? In addition, some of the other variables that we take into account are the subject's history, whether it's known or unknown. Do they have a history of using violence against the public or officers? Are they known to carry and use weapons? Are they known to flee police either on foot or in a motor vehicle? Do they have a history of alcohol or drug use? Do they have a history of mental health issues? And then any known medical history that we may have as police officers is going to determine what level of force, if any, that we're going to use. Next slide, please. In addition to the variables that I just mentioned, another thing we have to take into account is the subject's behavior. So this is behavior that's observed by police officers. It might be in the form of body language. It might be something as simple as verbal threats made by the subject. They're expressing verbally their intentions. For example, in our use of force policy, we've defined assaultive aggression, which are behaviors that constitute an assault or indications that an assault or injury to someone is imminent. And basically what that means is, for example, a suspect clenches their fists and their head goes down and their shoulder goes back. They take a wide stance towards a police officer. Most human beings would read that body language as aggression. And that taken with a cluster of a number of other indicators that we just mentioned, is going to help them decide what level of force, if any, that they're going to use. On the other end of the spectrum is passive resistance, which our policy defines, where the subject does not actively resist, but they also do not comply with verbal or physical control efforts. Excuse me. The decision to use force may also include, as I mentioned, threats, intentions, body language, and then protection from self-injury. So sometimes the decision to use force isn't really made by the officer, it's made by state law. An example would be the domestic assault law. That's language in it that says when probable causes exist that a domestic assault has occurred or evidence is present where a domestic assault has occurred, officers shall arrest. So there are situations where the discretion to arrest and potentially use force are really taken away from officers. Next slide, please. Let's talk more specifically about the Bloomington Police Department's arrest and control system. And this is something that has really evolved in the 17 years that I've been involved in training here. In obviously the 13 years that Sergeant McCarg has been involved with the system. We have three tenets that we use almost as a sounding board for how we evolve our system. And the first one is legal. So the legal validation really is built within the constitutional standards and prevailing in current case law. Those include, as I mentioned earlier, Graham versus Connor, a little bit more recently, Hill versus Miracle, and then an older case which is really involving deadly force, Tennessee versus Garner. The second is medical validation. Officers and trainers have to understand human performance under stress, and we have to use tactics, strategies, and techniques that fit the human condition under stress. Because in most force encounters, we as police officers are operating under a high level of stress, and our cognitive and physical abilities diminish very rapidly. So we have to implement tactics that fit the needs of those officers. And finally, we, under medical validation, we have to really look at the safety of the techniques and manipulations that we're using. And really the only way we can do that is the third tenet, the tactical validation. We use data, which we call tracking and trending, of Bloomington police force encounters to determine the effectiveness and the use of these manipulations. In addition to that, how many injuries do officers sustain? How many injuries do suspects sustain? It's very, very important to collect data as that completely drives our system. Next slide. So one of the things that came out a few years ago of this data collection in this study is this idea of team arrest to control. A bunch of the instructors, we did, I guess it's an unofficial study, multiple officer force study, which consisted of watching, at the time it was dash cam videos, and then more recently body cam videos, where multiple officers are trying to arrest and control a violent suspect. And one of the commonalities we realized is that, and these are videos from across the country, across the world, we realized that, one, there's nobody who's taking charge. Everybody kind of is really laser focused on their own little piece of the force pie. And what we found is because of that, because one officer didn't really know what the other officer was doing, they were really working against each other more than with each other. We found that the duration of those encounters oftentimes increased. The clock just ticked on and on and on. And at the end, the injuries to the officers and suspects had increased or were more likely. The amount of force needed to effect the arrest and bring the incident to a conclusion increased. So what we came up with here in Bloomington is team arrest control. So this is when more than one officer is on scene. We kind of designate a quarterback or a conductor, for the lack of a better term. And the fortunate thing about Bloomington is not always, but oftentimes there are multiple officers on the scene of a call. Again, not all the time. So we're able to implement this team arrest control strategy. So basically what happens is that all the officers are reading from the same sheet of music. They're all read up on the same play. So imagine like a quarterback or a football team, if they were to take the field and not on the same sheet of music for that matter, or not abiding by the same play, imagine what that would look like. And if there's any Packers fans on the city council, you should be yelling out the Minnesota Vikings right now. That's your opportunity. It would be complete chaos. And in reviewing these videos, it's exactly what it was. So what we found is when we have a quarterback who is kind of getting the big picture here and looking at the force encounter as a whole, we are able to make sure that everybody's working together to reduce, most importantly, reduce the duration of the force encounter. We found that there's a significant reduction in officer and subject injury. And that quarterback or conductor has the ability and the duty for our policy to intervene because they can see the big picture. Not only that, but when feasible, we do pre-incident de-escalation, but also it's so important to do post-incident de-escalation. And all of our conductors and quarterbacks are trained up on that tenet. Next slide, please. So before we get into specific techniques and manipulations, I'm just going to talk kind of broadly about what Sergeant McCarg is going to talk about here in just a moment. He'll get specific into some of the manipulations and the data that we've collected over the years. But when we look and evaluate a manipulation, it has to meet the needs of the average officer. And it has to be, that average officer has to be able to use that successfully in a real life force encounter. So it has to be gross motor in nature. So our data shows the techniques and manipulations that we train, officers have successfully deployed these techniques in real life force encounters. When data shows that techniques are ineffective, they're eliminated from the system. What this does is allows us efficient use of our limited training time. So that way we're not training, using training time to train techniques that really nobody uses or are ineffective. An example of this is a few years ago, we were reviewing data and we found that officers use a lot of takedowns very frequently, as is the case really anywhere when you're using force. Part of controlling somebody is getting them to the ground. We also find this is the highest area of officer and subject injury. So in an effort to reduce those injuries, we made sure we reviewed our takedowns and made sure that we teach only those takedowns that control the rate of descent. And that we found that has reduced injuries related to falling with respect to takedowns. So at this time, I'm going to pass it off to Sergeant McCard, and he's going to talk to you a little bit more specifically about what techniques we use and some data that we've collected.
Thank you, Officer Seifert. Please stick around. I'm sure there'll be questions as we get through this.
Well, thank you.
Thank you. And welcome to Sergeant McCarg. Good evening. Thanks for being with us tonight.
Good evening. Can you guys see me and hear me okay?
Yes, we can.
Well, thank you for this opportunity, Mayor and council members, to speak to you tonight on this important issue on force, police use of force. So I'm gonna dive right in right where Officer Seifert left off and get into the weeds a little bit with some actual Bloomington numbers and data. Now, it's important to understand the data and how it was collected. As Officer Seifert indicated, we began really tracking and trending this use of force data in 2010. The reason it started in 2010 officially is that was the year that we as a city got tasers. We were a little late in the game with tasers back then, but we wanted to see how our tasers held up with our current systems, our current ever-evolving systems. So we really wanted to evaluate the system as a whole. Now that Taser was here, it was a great time to start really collecting that data. And the way we collected the data was we wanted to see effectiveness rating, meaning if I do this, How effective is it? Is it 100% effective? Is it moderately effective? Or is there no effect where I have to do something different? And these numbers are all taken out of actual incidences on the street. So let's just start going through them. And this slide is a little bit lengthy because we go through each type of force that we're allowed to use independently. So this first one is manipulations. It's kind of an umbrella statement. Manipulations means anything that's pain compliance related, such as pressure points and things of that nature, escort holds, things like this. You'll see that it has a 38 during the years of 2010 to 2018. It's important that you understand that 2019 data is in, but the effectiveness rate is not in. That's why it's not part of this. But 2010 to 2018, 38% effective, 10% injury rate on manipulations. Moving down to unarmed kicks and strikes, pretty self-evident as to what those are. 44% effective rate with a 33% injury rate. Next one, please. Contact weapon, which means baton. It has a 20% effective rate and a 40% injury rate. Now, it's also important to note the injury rates are both officers and suspects together. So this isn't just officers, this isn't just suspects, it's tallied together. Next one, please. Chemical agents, 45% effective rate with a 9% injury rate. Takedowns, as Officer Seifert already spoke on these, we use them quite a bit when people. It's one of those things where people need to be better controlled. It's easier to control them on the ground. So in our training, we advocate for takedowns. They have a 68% effective rate here in Bloomington, but they do have a 35% injury rate. Next one. Less lethal munitions, 53% effective rate with a 26% injury rate. Now you're going to see the next portion here is not one of our force options, but it's just kind of a disclaimer. The gold in your PowerPoint here indicates the majority of these reported injuries were all very minor, consisting of scrapes and possibly bruises, and most of them were due to falling. Anything that you see here in that gold that's what the injuries were. Next one, please. So now on the right-hand side, you're going to start to see two different force options. You're going to see two vascular neck restraint types and two conducted energy weapon or taser types. And I'll explain both as we go along here. So the very first one, vascular neck restraint to stabilization. There are two types of vascular neck restraints that we use here in Bloomington. Stabilization is more of a psychological controlling phase where we're able to apply the technique, and I'll get into the weeds on what that means here in coming slides. But about 80+% of the population will submit to arrest at this point. And it's one of those things where the hold is put on. There's no pressure on the sides of the neck. They're able to breathe just fine, and they submit to arrest typically. We have an 80% effective rate with stabilization on the VNR, the vascular neck restraint, with a 12% injury rate. Again, that would be due to falling or scuffling on the ground. Going down the line, please. The next vascular neck restraint is the compression. So in our policy, I think you all have it before you, is both of these two levels. Compression occurs when the stabilization VNR is put on and the person not only actively resists, trying to make arrest more difficult, but now they display active aggression. Now they're actively trying to assault the officer. And so at that stage, we are able to continue to keep the stabilization hold, but just to compress the sides of the neck. And again, we'll see what that looks like here in subsequent slides in a moment. That is an 80% effective rate with 13% injury rate. Moving on to conducted energy weapon, that's our taser. Now there's two modes with the taser. There's a drive stun, and a taser basically works. There's a negative and a positive probe. There's two probes that go into a person, and it introduces electricity in the person. If those two probes are closer than 4 inches apart, you'll get pain compliance. It will hurt, right? If they are further, that's called the drive stun. If they are further than 4 inches apart, there's something that I'll talk about more in the next one, but it's called neuromuscular incapacitation. Your body locks up and you're incapable of moving. You just lock up and you fall down, right? So at a drive stun level, we have a 63% effective rate with a 33% injury rate with the drive stun with the taser. And again, that's most of those injuries are due to falling and scuffling. Next one, yep. And then we go to the NMI, which I kind of explained already. We have a greater than 4-inch probe spread on those the taser probes. And that has almost the same effective rate with a 21% injury rate. So if you're looking, the purpose of this slide is really to kind of show you what our capabilities are for non-lethal options that we have, and to evaluate it and see why we do what we do. And we're constantly, as Officer Seifert had already alluded, we're constantly evaluating our system and making tweaks to make it better. Next slide, please. So this slide, we're going to talk a little bit about just the Bloomington specific history and a little bit about history in the United States as well. But in Bloomington, we've been using some form of neck restraint since the 1990s. We've had hundreds of applications in that time. There have been 0 injuries due to the application of the LVNR, which is the old method, the lateral vascular neck restraint, and also the VNR, the current program that we use. And by injuries, I mean no neck damage, no cervical spine issues. There's been no trachea issues, no carotid dissections. And those are really the 3 main things that you worry about with neck restraints. Now, as I showed you in the previous slide, there were injuries. Those were due to more falling and scuffling on. There have been, neck restraints have been used in martial arts for thousands of years. They're widely used in this country and other countries. The vascular neck restraint system that we currently use in Bloomington mirrors that of neck restraints taken from jiu-jitsu, judo, or sambo, which are very mainstream martial arts that are done in a sportive manner, Olympics and other competition. I can tell you that just in America, there are over 86 million applications of similar vascular neck restraints done on man, woman, and children every year just in martial arts practice. And we just don't see any issues coming out of those as far as health issues. Some personal anecdotal applications for myself. I'm a 20-year jiu-jitsu practitioner, 20 plus years now. I've been training neck restraints for that long. I train these things multiple times a week, both statically and dynamically. I've been rendered unconscious multiple times. I'm here to talk to you about it. And I can tell you with all honesty, I've never had any neck issues from it, or any issues from it there, furthermore. And I've used it on the street as a police officer, and it's worked very, very well without injury to me or the suspects. Lastly, on this slide, I'd like to just point out that in the history of America, there's been no documented deaths attributed to a properly applied vascular neck restraint in this country by police. Next slide, please. Oh, so this one got a little messed up. Go back. Is your mayor and council members, is your caption there a little off? Yeah.
Yes, it is. It looks like the graphic, and Chris is going to move it for us here.
Yeah, that's great. Okay.
Look at that, real-time correction.
Yeah, there's a second one there, but if I may, some of what's going on right now in the media and in the world is a problem with linguistics. It's a problem with terminology, right? People loosely use the term chokehold and they clump it all together as one thing, which it really is not. It's kind of like, some people say comparing apples to oranges. This would be like comparing apples to a car, all right? They're 2 different things. The only thing they have in common is a neck. I'll try to explain it. So a vascular neck restraint, as we use here in Bloomington, is defined as a method or manner restraining or controlling a person. The technique focuses on pressure on the sides of the neck, limits subject movement, and when necessary, may be used to temporarily incapacitate the subject in order to handcuff them and better control them. You can see here in the little drawing where it says carotid restraint, that would be indicative of a vascular neck restraint. I apologize if this thing got a little messed up with the captions, but you see the officer in the back there encircles the subject's neck with his arm and creates a V around the neck. Notice the bicep is on one side of the carotid, the forearm is on the other side of the carotid, and I'm talking about the one with the two arrows now. And the chin is lined up with the crook of the elbow. When this is done to you or to people, you can breathe just fine. It's not painful. It's not an issue. What it does is it compresses, or it has the ability to compress the sides of the neck to temporarily incapacitate the person from a blood flow issue. Conversely, chokehold is different. Chokehold can be seen with the next caption over, where it says chokehold. And in our policy, a chokehold is deadly force, and it is defined as applying direct pressure on a person's trachea or airway, or the front of the neck, blocking or obstructing the airway. I'm hoping that these captions can make a little bit more sense of these two techniques for you guys. Okay, next slide, please. So in Bloomington, we ensure that all our VNRs don't become chokeholds by a process called landmarking. It's very important that our landmarks are proper. The airway is not affected, and proper landmarks basically are obtained when the officer creates a triangle around the subject's neck with an apex of that triangle in line with the subject's throat, kind of like the caption before, and you'll see in these photos here. Thus allowing for free airflow of the subject, and the officer has the ability to compress the sides of the neck if it's reasonably justified and necessary, if that suspect decides to become assaulted. By abiding by the landmark rule, officers ensure proper placement of the VNR. Very, very safe. I've got here in our slideshow the two Thules, Officers Megan Thule on the upper left-hand corner, next to Officer Steve Thule. No family relation. They just both happen to be named Thule, and you can see the size differential there. With the size differential, officers, both Thules, have the same responsibilities as police officers, and they operate very professionally all the time. Now, you can see Megan is a smaller stature officer. We had to come up with techniques and tactics and non-lethal force options that don't rely on pain compliance, because not everybody feels pain the same, and that don't rely merely on leverage techniques, because looking at large officer Thule, Steve Thule, leverage techniques on him by Megan Thule might not work because of pure mass. So we have just two options. We have the vascular neck restraint, and we have the taser. We have our effectiveness rates that you've already seen. So to kind of illustrate how this would work for Officer Thule, we have another officer here, Officer Van Hall, who's nice enough to be in this photograph with Officer Thule. After the takedown happens, she experiences the assault of aggression. She takes him down, and she gets her first landmark, which is her armpit is on top of Officer Van Hall's trap, and she encircles his neck. And you'll see in the slide as you're moving down to the right that his chin is in line with her elbow as she encircles it, and she's palm down on his opposite side shoulder, making a V around his neck, protecting his airway. And then she connects her hands, closing that triangle. That is a properly applied vascular neck restraint to stabilization. Next slide, please. So the vascular neck restraint is the safest and most reliable option for quickly controlling combative individuals when trained properly than most other force options that we have here, as you saw in the slide previously on all of our non-lethal force options. And I'm happy to say I've looked at a lot of curriculums out there. Bloomington Police currently has the gold standard in law enforcement for VNR that I've seen in the entire country. And I've looked at all of them. It's been medically, tactically, and legally reviewed and validated by outside folks in the country. So, next slide. And with that, I want to recap with Officer Seifert. And I thank you for your time, and I'll stick around for any questions that you may have. He has a couple more slides that we're going to review.
Thank you, Sergeant McCarg.
Hello again.
Officer Seifert.
So let's review some of the data and the information that we've shared with y'all before we give you an opportunity to ask us questions. Police use objectively reasonable force based on the totality of the circumstances. That's in Bloomington. That's the standard all across the country. The Bloomington Police Department system is legally, medically, and tactically validated. We track and trend the most recent data that allows us to constantly evolve and make sure that we have the most effective system available to our officers. We employ team arrest control strategies to quickly end force encounters, and we make judicious use of vascular neck restraints for single and multiple officers to quickly end force encounters. Vascular neck restraints have been in use in the United States for 244 years, in Bloomington since the 1990s. And our data shows that the vascular neck restraint is the safest and most effective way to quickly control a violent subject. Low incidence of officer and subject injuries and 0 deaths. Next slide, please. Just to review the Bloomington Police Department's data, in 2019, we had 46,239 calls for service. We had a 99.8% of police and public contacts do not require an officer to use force. 2,323 adult arrests were made from those 46,000 calls for service in 2019. And of those custodial adult arrests, 90 responses to an aggression and resistance were completed. So percentage-wise, that works out to be 0.19% of police contacts in our city result in force. And we are well below the national average for force encounters, according to the most recent Bureau of Justice Statistics data. I believe that's the end of the slideshow. Next slide, just to make sure.
Thank you both for the information.
Thank you.
Appreciate the presentation and the detail you're able to provide there. That's interesting and informative. Thank you.
Of course, you're very welcome. If you have any questions for us, we will do our best to kind of work this rotating puppet show to answer all the questions you might have here. So.
Very good. Thank you.
Cool.
I see Councilmember Martin with his hand up. Councilmember Martin.
Thank you very much, Mayor. And thank you again, Officers Seifert and Maharg. The data you provided was extremely helpful. I guess I've got quite a few questions here, but I'll just ask a few off the bat and kind of step back if my colleagues want to jump in. So just generally in the use of force policy we received, I see that there's both language should and must. Like, for example, in one section in the VNR on page 8, it's noted that after a suspect becomes unconscious, the officer, quote, should roll the subject onto their side into the recovery position. Or when you're talking about de-escalation in our policy, it says whenever reasonably feasible, according to BPD policies, officers should attempt to use de-escalation tactics. Throughout the policy, are we defining should as must or shall, or is that different language in different places?
So should would indicate kind of like de-escalation when feasible, when safely feasible. For example, for the neck restraint, once rendered unconscious, the subject should be rolled into the recovery position. That is under ideal circumstances where you don't have anybody else that is a potential threat or trying to get involved in the arrest. Obviously, if there are multiple people that we're dealing with, that recovery position is going to be delayed. And so that's why we use the language should. And then we say when feasible, as long as we have the time, they use the word discretionary time, but we also use the example of the active shooter at the workplace or school where there's active violence going on. It's obviously probably not an appropriate time to try to de-escalate. So that's where the when feasible comes into play. I hope that answered your question.
Yeah, absolutely, and kind of gets to my next one as well here. So, with the kind of reasonably feasible standard for utilizing de-escalation, so is the definition of reasonable there kind of the same parameters as we use in the section that more deals with non-deadly or deadly use of force, the objectively reasonable force standard there? Is that reasonable the same in both those contexts, deciding if escalation is objectively feasible or if use of force is objectively reasonable, the level of force?
And Mayor and Council Member Martin, the best way I can explain without a graphic, and I'll try my best here to explain what reasonable, objectively reasonable is, because it can be kind of nebulous. It can be a bit confusing to new police officers too. So imagine we have two pools. On the left side, we have our moral pool. On the right side, we have our ethical pool. Okay, our moral pool is based on our upbringing, our gender, our religion, our race, our socioeconomic status. On the right side, we have our ethical pool that is based upon constitutional law, state law, department policy, and finally training, which is the bedrock of all that. As police officers, if we do our jobs based on our moral pool, those decisions we make become unreasonable because they're based on race, gender, religion, socioeconomic status. Okay. If police officers go out on the street and do their job based on the ethical pool, based on constitutional standards, state law, department policy, city ordinance, and finally training, in the majority of cases, those decisions made are reasonable. Does that make sense?
Okay, that does.
That's what we talk about when we say objectively reasonable.
Okay, thank you. And just last kind of area real quick here before I take a step back from my colleagues. So to the point, vascular neck restraints, I had seen one area officers may use arms, legs, and clothing as a manner or method of applying a vascular neck restraint. I guess how would an officer use clothing in a VNR? And then how would that clothing be applied differently in a level 1 versus 2 VNR scenario?
Mayor, Council Member Martin, while I am well versed in the vascular neck restraint, I'm going to pass it off to Sergeant Marcard to answer that question. So please give me allow Sergeant Marcard to step.
Thank you for your question. So the question is mainly about the clothing. Is that right?
Yeah. Yep.
Okay. You can the vascular neck restraint, as I kind of spoke to before, when you need to go to compression, when you're forced to do so, you target the sides of the neck, okay? Not the front of the neck, and you are able to, using somebody's collar, do that with one side while using it with an arm on the other side, without giving away any of our tools and tactics to the public, because this is a public forum. You are able to do that without adversely affecting the front of the neck, which is what we really try to avoid, and the spine.
Okay. And I understand with kind of proper application, there's just no recorded deaths or serious injuries. But I know, as we've seen through kind of recent reporting, Bloomington is one of the last major law enforcement entities that's still utilizing VNRs in non-lethal applications of deadly force, as far as I understand. So considering that the post board doesn't recommend it, it's not covered in basic police academy training, as far as I've seen. I guess, is there a reason why those other departments would have moved away from that? I'm just not sure why we're the outlier and still deploying this particular tactic.
Yeah, thank you for the question. I think that I can't speak to other agencies.
Sure.
I can't venture to guess why they went away from it. I can only speak to the data, and I can tell you that our whole system is data driven, and data is clear. We've been using this tactic for since the 90s. It's worked well for us. We've had no adverse effects. To take something like this away, which a lot of the other agencies have done, I'm curious as to where their injury rates are going to go with lesser forms of control. Again, I'm not going to get into what this agency or that agency will do, but I can speak to ours. And since we are data driven, that's why we still have it. That's why we still think it's a very valuable tool for not only officers, but for the public.
Excellent. Thank you both very much. I'll quit monopolizing the questions.
Thank you. Councilmember Coulter.
Thank you, Mr. Mayor. So just a few questions, and these are going to kind of go all over the place, but just quickly, I know, just following up on what Councilmember Martin just brought up here. I know obviously you said you can't speak to what other departments do or don't do, but I think that kind of research would really be helpful for us in this conversation because, you know, as I think of the list of law enforcement agencies that either don't use them or specifically prohibit them. I mean, it includes the police departments in St. Paul, in Rochester, in Mankato, Moorhead. I think Duluth was on that list as well. The St. Louis County Sheriff, the Minnesota State Patrol. So, you know, these, I mean, you know, we all like to think Bloomington is the best police department around, but you know, these other agencies are not exactly slouches either. And so I think it would be really helpful to know, and this is more frankly a comment for Chief Potts, who I assume is still listening out in the hall or something than you specifically, but I think it would be really helpful to know what other departments do, so that when we're evaluating and having these conversations that that we have a broader base of knowledge there. My question, though, and I guess as I'm thinking about it now, the second question is something that may be best communicated in writing, but you know, we were given these percentages on the different force options that are available. I would like to know number of uses as well, because percentages are helpful, but you know, a 33% injury rate and for something that's only used 10 times is very different than, you know, a 12% injury rate for something that's used 200 as an example, right? So I think it would just be helpful for me to know the specific numbers there. But the questions that I had, there was some highlighting of proper DNR usage, and I'm wondering if you can speak to improper usage, I guess, or improper applications, maybe the better way to approach that, because I understand certainly that folks are well trained, but you know, the question still is what happens when things go awry, when things are either intentionally or unintentionally used improperly.
Thank you. So, Mr. Mayor, Councilmember Coulter, I think what you're asking in that last question is, what do we do when things aren't proper, right? If I can go backwards in your questions. That's a great question. We train all of our officers that it's right in our VNR training curriculum, which is documented with the Post Board and post accredited. That if your VNR is not working for some reason, you have your landmarks and things are not working the way they are designed to, you need to transition to another force option. And it's a very well ingrained in our officers. So something's not working, we have to transition. Does that kind of answer that piece?
Yeah, I mean, I guess what I'm getting at more is, you know, we saw that there was you see, the specific phrase was 0 deaths for proper DNR applications, and I guess I'd like to know how improper or incorrect applications, how that factors into that discussion.
Sure, I can give you a historical piece from probably better in a writing synopsis. I can give you things.
That's fine. If it's easier for you to write it out, that would be fine. That's just a question I had. And then changing gears slightly, I don't know who's best to answer this, but the use of force policy, or the policy, excuse me, does reference use of chemical agents. That was referenced in the discussion earlier, and I'm wondering what chemical agents do we have on hand within the Bloomington Police Department? How often have they been used, and that sort of thing?
Well, we have officers on their belts are given the option of basically two types of chemical agents for on their duty belts. One is a mixture of OC, which is pepper spray. It's a completely organic irritant. And the other is CS, which is a mixture. Well, there's CS, which is chemical irritant, and then the pepper spray. So the only two that I'm aware of that we have here.
So that, sorry, to clarify, that's it. The Bloomington Police Department does not have tear gas on hand or anything like that.
Well, I guess it depends on how you're defining tear gas. Maybe the chief would be better.
Yeah, maybe. Yeah, that might be the case. I'm looking at the policy here, and chemical agents and munitions are defined as any chemical irritant that can be deployed by hand, aerosol projector, or launchable device. And so I'm wondering what we have on hand, whether, I mean, not necessarily that's carried on, carried by officers on their individual person, but what we have within our, for lack of a better term, arsenal that could be deployed by the Bloomington Police Department.
Absolutely. I would like to defer to Chief Potts if that's okay. Thank you.
Mayor, Councilmember Coulter, I think we talked about this back on the 22nd, but the chemical munitions that we have, as just defined by Sergeant McCarg, is two types. One is an officer has the ability, an option, as talked about, and then if there's a riot type situation or crowd control, we have some of the chemical irritants that can be used in a crowd control situation. And those are only used if there's a true safety to the group, safety, public safety, or potential for injury, in where a crowd control situation may be out of control. And those then can be used at the discretion of the incident commander, which I think in the last presentation I mentioned that maybe a deputy chief or myself. A commander, a deputy chief, or myself in a situation where we're monitoring, and the supervisors, the officers, everybody is monitoring it. But again, the factors to consider there is, is there potential for things for people to get hurt or injured? There's a true public safety risk, and that particular tactic can be used, but only in certain situations. And in my experience here in the Bloomington Police Department, I think I mentioned, is extremely, extremely rare. And so, while you heard a lot about that in Minneapolis in the days after May 25th, those were some riotous situations and crowd control situations that were clearly, as we watched on TV, very much out of control. Fortunately, here in Bloomington, we haven't seen those types of incidents, and so therefore we haven't had the experience of having to use those very often. But those are the types of situations, Councilmember Coulter, where something like that may be used.
Thank you. And then the other questions I had, and maybe actually this is probably a question for the city manager. The other questions I have, I would say, are more applicable to use of deadly force. I know the topic tonight is use of non-deadly force, so I don't want to cloud the issue too much. Will we have another opportunity in the future to discuss deadly force in more detail?
Mr. Verbrugge?
Mr. Mayor and council members, Councilmember Coulter, I would say that it's up to the council to dictate what additional conversations you wish to have. If that's an area that the council wishes to explore further, we'll set that aside on an agenda at some point in the future here. I think it would be helpful to understand from the council exactly what the learning is you'd like to get out of that conversation, Councilmember Coulter.
Sure. So what I think I will do then is hold off on the other questions that I have and see what the rest of the council thinks about that. And then, Chief, if we decide not to have an additional study session or additional conversation on this, then I'll follow up with you and we can talk about those things on the phone or something like that. So thank you.
Councilmember Nelson is up next, and I do want to. I don't want to squelch conversation here, folks, but we're pushing a couple hours in, and we have an equally meaty topic as our second topic of the evening. So I just want to keep that in mind and make sure that we get to that at a good hour as well. Councilmember Nelson.
Yeah, thank you, Mayor, and I will apologize to you in advance for not minding just the comments you just made. So I have a series of questions here. Hopefully it doesn't take that long, but I noticed in the data, I just want to make sure I understand the data, that it indicated these were adult arrests. Am I correct in understanding that they do not include juvenile arrests? And is there a reason for that? The obvious implication may be legal, but is this data all of the arrests or not?
Chief?
Mayor, council member, you are correct in that it is the adult data only. And the only reason for that is that in our efforts to try to prepare for this, the data collected on juveniles is collected differently. And what we could guarantee that this data was accurate. What we couldn't guarantee in terms of the presentation tonight, in terms of how we collect data specific to juveniles, that we were not fully confident that the data that we could present to you was going to be entirely and 100% accurate and understandable. And so while we're not trying to hide that data, we just collect that data very differently, and it's not as easy to present. Now, what we can commit to you is that if you would like a further breakdown of the data relative to use of force involving people under the age of 18, we can provide that. It's just in terms of working towards a presentation tonight, what we could do is pull that adult data together more easily, and we're confident in our ability to present that tonight.
Just as a follow-up to that then, Chief Potts, I assume you've reviewed it and others, is there any striking differences between that data, the adult and the juvenile data, that we should be aware of in terms of our thought process on these issues?
Mayor, council member Nelson, no, there's nothing striking. I think we can still say confidently that our use of force here in Bloomington, whether it be with regard to adults or juveniles, is under the national average. And I don't think that you'll find anything striking about data relative to juveniles.
Thank you. My next question has to do with the data indicated that we, in comparison to the national standards, utilize these use of force options lower than other places in the country. And one of the things that I didn't see in here was data regarding the use of de-escalation techniques. If that is impacting us, if we're able to de-escalate many more situations before they get to a point where an officer needs to use one of these options. So I'm just interested in if you have that data on prevented use of force options by utilizing de-escalation. And if not, if you have a sense of how that is working for us.
Chief?
Mayor, Councilmember Nelson, I think what we can say here in Bloomington is that we committed to getting everybody trained in this CIT training and exposing everyone to de-escalation training. We think that is effective, that further reduces the number of force incidents that occur in Bloomington. But the reality is officers are using de-escalation tactics all the time. It's not just in situations that one might think will lead to force. It's built into the fabric of how they interact with the community. And so it's funny that you asked that question, because just today, in the last couple of days, as we've been working late last week and towards today, is trying to better capture the amount of de-escalation that actually goes on and how that might be interacting with the number of force incidents. As you saw, 90 in the course of a year in 46,000 documented contacts is 0.19 of a point, less than 0.2%, less than 0.02%, right? I mean, this is a small amount of times when force is used, but we don't even capture all of our contacts with the community. Just the 46,000 are those that are calls for service or what are captured in the CAD system. And de-escalation is going on not only in those 46,000, but in a whole bunch of other encounters that our officers have in the community. And so I will say I can speak to this anecdotally, and that yes, I think it does make a difference, but it's also something that we want to try and figure out a better way to capture, whether it be on crime reports, simply within our CAD system, but so that I could stand before you and give you a better, verbal kind of picture of how well de-escalation works. We just don't have that data right now to be able to tell that, any more so than we have already tonight.
Thank you. I appreciate that. And just quick follow-up comment on that. Similarly to how you've tracked data regarding the various use of force options, it may be interesting to look at if there are specific de-escalation techniques that you teach, to look at the effectiveness of those as well, to determine which are, we should continue to use, which maybe don't work, those types of things. Just, I appreciate that you're going to look at that data. I don't think I need follow up on that. Just my own thought process there. What are the others? I think I got like two more questions. Approximately 5% of the interactions led to arrests. 46,000 interactions, 2,300 arrests approximately. So about 5%. Indicates to me 95% of the time that our police officers interact with someone in a formal way that's tracked through that system, there isn't an arrest. Going back to our previous conversation about community building and things like that, what are we doing during those interactions to sort of build the relationship with those members of the community, because we aren't arresting them, and there may be opportunities to make that into at least less of a negative experience for them. Are there specific things we're training our officers to do there?
Chief Potts.
And just so I'm clear, Mayor, Councilmember Nelson, are you talking about in the 95% of the cases that we do not arrest, or in the 5% where we do arrest?
I guess my thought was more in the 95% where we don't arrest. I'm hard pressed to find a way to make getting arrested a very positive experience, but it can be less negative than it otherwise would be, I suppose. So, but my focus was on the 95%.
So, Mayor and Councilmember Nelson, actually, I think we focus on both sides of it, the 95 and the 5. The 5% is trying to do it with the least amount possible, as professional as you can, and only using force when you absolutely have to. I think that may not seem like an effort to try to make that situation better, but I think it is, especially when you consider the result of that is using force less than perhaps some other agencies might. The 95%, again, I will say that I think in what we're building into the fabric of this organization is a level of professionalism. On top of that, it's trying to build relationships in the community. And so even though you may have a contact in that 95 percentile side of this equation, that is a theft report, might be otherwise a very, a traffic stop for that matter, a medical emergency, that our officers are always trying to find ways in those encounters to build a positive, leave them with a somewhat positive impression of the organization. That's the expectation that we have on our officers, that they're professional, they're empathetic, that they're trying to treat the community, frankly, as well as they possibly can, right? Because this may, in fact, be the worst day of their life when their house gets broken into or when some other crime happens. And so we are always building on making sure that when you're dealing with the public, that you got to remember that this may be the worst day that they've had in many, many years, and do whatever you can to leave them with the impression of our organization that we're professional, empathetic, and we care about the community deeply. And I think they do that quite well, frankly.
Thank you. Next question quickly here. There was an indication early on that use of force is used to prevent self-injury, and I think I forget the exact words that were used, but it certainly was fairly common, maybe, that it was used in that. And again, this gets back to our conversation previous about the embedded mental health professional and other options in that area. Do you foresee that we may have options or things that we could do to prevent or to avoid using these types of techniques to prevent self-injury? I think that's a big concern for all of us.
Chief Potts?
Yes, that Mayor, Councilmember Nelson is a fast evolving subject within use of force or response to aggression and resistance, and that was essentially that was the topic of a statewide critical issues forum that we hosted right here in Bloomington last year, where we brought in some of the national experts, some of the local mental health professionals and experts in that field to really get at this issue of what is the appropriate response from law enforcement on someone who is obviously experiencing crisis, and it may be in the form that they are threatening or actually trying to harm themselves. And you really get two different schools of thought depending on how you talk to. The mental health professionals would tell you that police officers need to do something to prevent that situation from getting worse to the point where there may actually be an attempt at suicide. While you then have to factor in the liability of the police intervention, right? And what might come as a result of the police trying to intervene with the situation and how the force used may escalate, right? And that is a very, very relevant discussion that is still going on today. And I think here in Bloomington, we're trying to kind of thread the needle, right? And when it comes to using force on someone who may harm themselves, oftentimes there's other people in the home that may be within close proximity that they may be also at risk. If it's someone that is only a threat to themselves and no one else, we oftentimes have the conversation in our patrol division about whether or not you just leave, you try to connect them with some kind of mental health resources. Oftentimes that might be a crisis line. And we really contemplate seriously whether or not we force a contact with the police or we simply leave. And we're always trying to make that decision with as much information as we have possible. But that has actually happened on a number of occasions where we are unable to come to a point where the person is going to allow the officer to come into the house to have a conversation. They may still be threatening things to their friends or maybe even to us verbally. And because they're only a threat to themselves and no one else, we have to make that hard decision to sometimes that we don't force that intervention. We don't force the contact because of the force that may be needed for that to happen. And we put them in contact with mental health professionals, and we'll unfortunately have to leave the situation. But there are other scenarios where someone is in front of you and, for example, has a knife and is cutting at their wrist. Now, that is not something that an officer can stand there and just let happen. They have to intervene. And in that case, a very common tactic might be a taser if they can safely deploy it, or a less lethal munition. But you can't stand idle and stand there and watch someone who's seemingly intent with a knife to really kind of harm themselves seriously. And so those are a couple of different scenarios. I could probably talk for an hour or two about this topic, as we had 150 chief law enforcement officials and command staff members from all over the state come here to Bloomington last year to really dig into this issue. And I can tell you that it's not fully resolved, that police departments are still looking at their own practices, trying to figure out how do they appropriately respond to this, a situation that might be a person threatening to harm themselves, but really no one else is in the area or who could be harmed by that. And in some cases, the officers are just leaving. In other cases, the actions of the person necessitate action by the officers. And then, as I mentioned with the knife situation, some force may be used. But again, it's a very, very hotly debated topic at this time.
All right. My last question I have is regarding the mutual aid situation. We have our policies in Bloomington, but our officers respond to things in other communities at the request of those communities. Vice versa, we have their officers come into our community if necessary. How has that worked out with regards to our policies if our officers are put in a position to do something that may be contrary or not, not the norm in Bloomington, and vice versa? How are those types of situations resolved?
Chief Potts.
So, Mayor, Councilmember Nelson, that's where the value of training with your partner, your neighboring cities is really important, so that in most cases, the call for assistance or mutual aid is going to come from a city that borders us, or perhaps it's the Hennepin County Sheriff's Department. And so we spend a lot of time training with those agencies. we have a multi-jurisdictional training center over in Edina that's co-owned by the cities of Bloomington, Edina, Eden Prairie, and the airport. It provides us with a location to do that training. In the interactions between the officers from those agencies and our officers that are occurring on a day-to-day basis on the borders, and having a pretty good working knowledge of the abilities, the policies that exist. And there's not great differences between our neighboring cities, especially as it relates to policy. There may be, some kind of nuanced differences, but we work with and train with those cities often enough that I'm confident to say that when we call for mutual aid from whether it be cities to our north border or cities along our east or west or south, that we feel confident that those officers who come in are going to be able to handle the situation appropriately. But we also make sure that we have active supervision, active, as Josh called it, a conductor or a quarterback, so that if they see an officer, even if it's an officer from another city, that they act, right? We call that active bystandership or quarterbacking of it. And we will have somebody in a role that's going to closely monitor those officers, even if it's a incident that has just officers. If a supervisor comes in, that's obviously going to be something that they're paying even more attention to.
Thank you very much for your time. I appreciate it, Chief Potts.
Thank you, Councilmember. Good questions. I see Councilmember Carter and then Councilmember Lohman.
Thank you, Mayor. Okay, so a couple clarifying questions. All of the use of force data presented tonight was for non-deadly use of force, correct?
Chief Potts.
So what you saw for yes, non-deadly use of force, correct.
Okay. And then there was a lot of talk about the vascular neck restraints. Now that's a non-lethal option, but then there's also chokeholds, which are a lethal option, correct? And then do we allow chokeholds?
Chief?
So I can take a stab, and then I'll have either Josh or Cullen come back up here. So you are correct in that we train at the Bloomington Police Department and authorize the use of what's called a neck restraint, vascular neck restraint. That is not the same thing as a chokehold. A chokehold, just fundamentally, the differentiation is that obstructs the airway. We don't train any techniques or allow any techniques that obstruct the airway from being used, unless there's a situation where an officer is literally fighting for his or her life or trying to save the life of another. That presents itself as a deadly force option. So as an alternative to a handgun, that maybe a choke might be something that the officer could do. Maybe they've become disarmed, but it's not something that we as a department are training on an annual basis for officers to use. It's just simply something that we believe if an officer was in a fight for his or her life or trying to save the life of someone else and deadly force was authorized, but only if deadly force was authorized, that may be an option or an alternative to, say, a handgun.
Okay. Are you bringing up any of the other officers? I mean, that answers my question, so I don't think.
Do you want me to? I can if you want. If that's sufficient, we can move on.
Yep,
okay.
Yep, that's good. And I know Mayor Bussey's probably wanting to yell at me right now. So, my other question around the data, can you share the data broken down by race and ethnicity? And that can be via email if you have that.
Mayor, Council Member Carter, we can work on further disaggregating that data. I think that's because most of those cases that involve use of force also involve an arrest, right? That usually is they go together. That we do have that race data on arrest situation, so that is something that we should be able to provide. Yes.
Great, thank you so much. And then is every officer in the BPD trained on neck or vascular neck restraints and chokeholds, or is it just like, because I know in our policy it's only those who are trained, and so, but I'm wondering, is that everybody? Is that kind of typical in the training that we offer?
Chief Potts?
Mayor, Councilmember Carter, that is correct. That we spend a lot of time in the orientation training on use of force, the entire system that we use. And essentially the first 5 weeks that an officer works here, we put him through a very extensive orientation, and during that orientation, again, a significant portion is about the appropriate use of force, and during that, we also train them in the use of the neck restraint. So when it says appropriately trained, that means that we, as an organization, based on the data that you guys saw in terms of the injuries and the effectiveness and overall our use of force program, we teach that as an entire package to all employees of the Bloomington Police Department.
Okay. Yeah, I would definitely love to know more about, data disaggregated, but also, if and when chokeholds have been used. It doesn't sound like they're used often, but I would be interested in that information. And then
real quick, Councilmember Carter. I just was going to say.
Oh, go ahead.
I'm just going to give you a quick response. We don't have any documented choke uses here in Bloomington. As long as I've been here, and I'm looking at our 2 use of force trainers, they have no recollection of a documented chokehold either.
That's helpful. Thank you. So then there was some language in the presentation about something, the techniques being medically validated. What does that mean?
Mayor, Councilmember Carter, I'm going to let Sergeant McCard talk about that, as he was the one who worked directly with the staff that we brought in to vet the technique. So I'm going to step away.
Sergeant, welcome back.
Thank you. Mayor and Councilmember Carter, I believe the question was, what does it mean that the technique was medically validated? Is that right?
Yeah.
So when we rolled out our program, we wanted to validate it both tactically, medically, and legally. Obviously, we worked with our city attorney's office to legally look at this thing and vet it. And then we reached out to an expert in the field who's an outside expert. His name is Roy Bedard from RRB Systems. He's from Tallahassee, Florida. He's an officer down there for the Tallahassee Police Department, and he is considered a subject matter expert in neck restraints, amongst other things. We had Roy Bedard and his counterpart, who is a medical doctor and also a part-time police officer down in Tallahassee, come up here, and we essentially taught them our system and had them peer review it, to include the tactical side of it, which Mr. Bedard was well versed in, and also the medical side of it, which Dr. Bellamy, who came with them, was extremely well versed in. He's a emergency room doctor.
Okay, that's super helpful. Thank you. So I guess the other couple of questions I have are more specific to our policy. And in our policy, there's language around deadly force, and then and use. And I don't want to say this in a way that misrepresents what our policy says. My computer just shut down, but it has language in there around being careful around the use of deadly force with elderly, young, small children, or women known to be pregnant. And to me, that just feels really. I know there probably are extreme incidents where maybe use of force needs to be considered in those situations, but particularly for young, small children and pregnant women, I mean, I can't understand why we have that kind of language in our policy and why that would be allowed. But I also don't have the data. So I don't know like how often you encounter, young, small children or pregnant women where you need to consider using force on them. So I guess I'll say that I don't know if you really need to respond, but it is a concern that I have in our policy. Yeah, and then I think I've taken up enough time, so I should probably stop.
Mayor and Councilmember Carter, I would like to respond with a little answer, if that's okay. Those are standard cautions that are very typical in any type of vascular neck restraint policy. And the reason being, especially when you speak of elderly subjects and juvenile children, pregnant women for obvious reasons. But when we don't put an age on this, because there are many people who may be considered elderly by legal definition, but who are in way better shape than me. And there are many people that are younger than me that may seem elderly, right? And so and same thing for children, right? So we don't put an age on it. There are many 12 or 13-year-old kids who would tower over me, right? There are also many kids who are 17 years old who are just very small stature and not fully developed yet. So we don't put an age on it for those reasons. We put a great deal of faith in our officers and our training, that we train them to use very good discretion and judicial use of force only when reasonable. And those are very standard cautions across the board.
Well, thank you for that. I guess my last comment would be, obviously we're in a very intense time in our country, and there's a lot of tension right now, particularly when it comes to, community and policing issues. And, I really am feeling optimistic about the approach that Chief Potts is taking and our police department is taking, particularly around community engagement and relationship building and, building trust in the community. And I think that's critically important. And I was actually having a conversation with an officer relatively recently, and he was telling me how he had a really powerful experience where he went to a woman's house, African American woman, and he had gone there a couple different times. And she made a comment to him once, and it was, I wish that you guys would just come up here and see me as a human first and not a suspect first. And I know the opposite of that is that police officers also want to be seen as humans, right? And so I think that when we communicate, when we present this kind of information, when we're talking about policing issues and out in the community, and I hope that we can start changing our language and the way that we talk about things to be more human centered and kind of use more humanizing language, because I think that I don't know, it just strikes me that we often really lose that human piece of all of this. And no matter what stakeholder you are, whether you're a police officer or a community member, and so something to consider for you, sir, and for Chief Potts and for all of us as we continue to have these conversations.
I appreciate that.
Thank you, Councilmember. Councilmember Lohman.
Thank you, Mayor. I know these two topics can dovetail. You kind of mentioned that earlier here. So I did have just some questions here. I want to get through them real quick. Chief Potts, what I heard through the presentation today was that the department is driven by data. You presented that data for us to see, and I also saw that one of your training officers talked about this idea of an ethical pool and a moral pool that you utilize that is based on the Constitution and based on our ordinances and on our structures of law. And that's the underpinning of really how both these non-lethal uses of forces are kind of from a policy standpoint ascribed to, and then also administered. And I would imagine that is what I'm going to find if I look on the other side of the piece in terms of the lethal uses of force. Is my understanding correct?
Chief Potts?
Mayor, Councilmember Lohman, I think absolutely. I think that Officer Seifert did a nice job of trying to explain kind of the differences there. And we do build the entire program on some principles, and one of them was just what you described, right? The legal basis and necessity for the use of force has to meet the legal test, right? Graham versus Connor is the landmark case that Officer Seifert talked about, which sets forth the objective reasonableness standard. And so our entire use of force policy needs to be grounded in that. Reasonableness standpoint. Now, we, I think, go to a great length in our training of our officers to make sure that we're providing them with enough training time, enough those key cases but also enough training time so that the tools and techniques that we give them to use, they can use those appropriately. And in the case of the neck restraint, that may be why some other agencies have. I think,
Chief, if I could just interrupt for a half second here. Dwayne, you might want to try going on mute. We're having some audio difficulties here, and I'm not sure if it's, not sure where it might be coming from. Can you try to get, I'm sorry, Chief, go ahead, please.
Sure, no problem. Real quick, Councilmember Lohman, I think it's just making sure that we take the time with our training team here to make sure our entire department has a very good working knowledge of our use of force policy. And again, it is grounded in the most recent laws, the most recent court decisions, but also in this idea that we only want to use the least amount of force necessary when our officers are interacting with the community. And so I think that might play into why some of the statistics that you saw are what they are today.
Thank you, Chief. That sets me up for my next several questions here. So we've got this this conducted energy weapon taser stun and the conducted energy weapons taser. And one of my questions I had is if you end up having on heavy clothing, heavy gloves, and that type of thing, is that effective? Is that an effective use of that taser type thing? And then what happens if you're not able to utilize that taser? What happens at that point? Where does it move?
Chief Potts?
I'm trying to pull up the slide, Mayor, Council Member, that showed you kind of the effectiveness ratios. And I know, Chris, if you want, you can try to find the slide, but it's the one that looks like this. And I'll remind you that the taser drive sun and taser, what we call NMI, are both about 63 or 62% effective. And so why they're only 62 or 63% effective is because sometimes it's clothing in the winter and they aren't always fully effective with large jackets. We found that to be true, particularly here in Minnesota in the winter. And so you are correct in that some of the other options, the effectiveness percentages are lower. And the taser, it can be because of clothing. It could be because the person's in motion. It could be a lot of different things that ultimately what we know is the taser is in that roughly 60% effectiveness kind of range.
So if those aren't effective, pardon me if I'm getting into tactical stuff here, but if you're not able to utilize that conductive weapon piece, where do you go next then? If you decide you're not going to use the taser, what would happen next then?
Mayor, Council Member Lohman, I think this is a good point in time for me to have one of the training staff come up here and kind of go through that, because I think it's a very good question. And I think I'd rather give them the opportunity to try and answer that question. So I'm going to step out real quick and they'll be right here.
Mayor, council members, I'm sorry,
Sergeant, please.
The question is once taser or some other force option is deemed ineffective, what do we do then? Is that fair?
Well, just so I'm clear, let's say that we, for whatever reason, the person's got heavy clothing on and you can't use this, the taser option. What's next?
Yeah, that's a great question, and it happens quite a bit. We as police officers, if we have to make that arrest, we have to make that arrest, and we have to, like I kind of mentioned earlier, with the neck restraint. If the neck restraint is not working, we must transition to another force option. So that could be a neck restraint, another one of the other options that we have on this list, right? So one thing that needs to be understood, and it's sometimes hard to understand, is that force encounters are right in the statute. It says it. They're tense, rapidly evolving, and they happen really, really fast. Okay, sudden things happen, and it's not a choreographed event typically. tense, uncertain, rapidly evolving. So when something happens, you transition to another thing that may or may not work. You have to transit. You have to be ready to transition to another thing. We spend a lot of time with our officers doing what's called tactical planning. And so that is for that individual officer, not only do we train team arrest control, as Officer Seifert spoke to before, but we also talk about tactical planning. What is the individual's officer's go-to thing with this list in mind, with the tactics that we all teach them? Now, everybody's a little bit different, right? But the end goal is always the same. We have to get this person in handcuffs. And it's important to understand that, and don't take this the wrong way, but there's nobody that fights like the police. The reason I say that is that it's not just mano a mano, let's fight. It's every force encounter needs to end with this person's handcuffed and behind their back typically. So it's not like a mano a mano fight that you'd see on the street between two drunk guys at the bar or whatever. It's this is effective force for a reason, because there was a law violation. So I'm getting a little bit long-winded on this, but it's important that you understand how force incidents occur and that it's rapidly evolving. So to answer your question shorter, we must transition to another force option from this list.
And so you had mentioned earlier this idea of data-driven. You have, these are in a sense a toolbox of options, and they're based on an ethical pool. As I start eliminating those, or let's say you don't have those available, what is the transition? Does that shorten the transition time between the non-lethal force of options and the lethal force of options? If you could opine on that or talk about that a little bit.
I could, and it certainly could. Again, every single force encounter is different. There are no two that are the same. But I will say, and it's common sense, that if you have a toolbox full of 5 tools and you take away one, you're now left with 4. You take away 2, now you're left with 3, and so you become more limited in your trade craft, if you will, the less tools that you have, and force can escalate if you don't have the proper amount of decisive force early in the game.
Thanks for that. And what I heard you say is that when you shrink that box down, that can have an impact, but every encounter is different, but it can have that happen. So just my last 2 questions here real quick here, and anybody can handle them. I imagine that there are other parts of the country or maybe other parts of the world that may utilize this vascular neck restraint. Would we find the exact same data with that? And are they basing theirs based on data-driven or ethical pool? You don't have to answer that now, but that's something I'm interested in from a data perspective, to get that back. And then I thought I also heard you say that the chokehold and the vascular neck restraint are 2 different things. And I thought I heard you say that you train for the vascular neck restraint and that you do not train for the choke hold.
Mayor Lohman, answer your some audio issues. To answer your question, sir, first, the latter part of your question, the vascular neck restraint and the chokehold are 2 different things. We train our officers at a minimum every 2 years. They recertify in the vascular neck restraint, but they get much more training with it yearly in our in-services when we train team arrest control. But they certify every 2 years, and they go through a series of testing to keep certified in that. The chokehold is a deadly force option, like Chief Potts spoke to before. We explain to officers what it is, and we define it in our policy. We don't train it as often as we train the vascular neck restraint, because we have other lethal options that may or may not be, well, that are probably better, that is more valuable for us to spend our training time, or our limited amount of training time doing. And then if you could, you had asked about other agencies and other information from other agencies. there are agencies throughout the world that use vascular neck restraints. There are many studies on this by agencies, by other scientific groups. This particular type of technique, the vascular neck restraint, has been studied in scientific settings more than any other police type tactic. Than out of this entire list, we have more data on the vascular neck restraint that it is safe when done properly, as we've been saying, than any other technique here. I am happy to provide you with some of those studies. I can email them to you or get them to Chief Potts, but there have been very large studies done, and there's more that are ongoing. Does that kind of answer?
Thank you. That does answer my questions. I appreciate your distinction between what a chokehold is and and as far as I can understand, a chokehold is not a part of this non-lethal force options the city of Bloomington utilizes. And we do not train for that, and it's not a part of that.
That's absolutely correct.
Thank you.
Thank you, Councilmember Lohman. And I think we saw a graphic on that, and I'm assuming it will be part of the presentation that is made available to the council after tonight. Councilmember Beloga.
Thank you, Mr. Mayor. Virtually all of my questions, except for one, have been asked and answered. So I'll go to the one remaining question I have, and that is, there's a lot of confusion, and I think vascular neck restraints get lumped into chokeholds. In fact, in the event that occurred in Minneapolis with George Floyd, that was called a chokehold, which it most certainly is not. But when our other, when our other cities have outlawed, to use the term, chokeholds, I presume that that is by definition and does not include vascular neck restraints. Do we have any information on that?
Mr. Mayor,
Sergeant,
Councilmember Beloga, I again, I can't speak to other agencies and why they make their decisions. I will say that in Bloomington, we do not train chokeholds for, it's like I spoke about before, we don't train chokeholds for non-lethal reasons. We do train vascular neck restraints. The two are very different. As far as the other agencies that have gone away from them or never used them, I can't speak to them. We're data driven, and this particular technique has served Bloomington police and Bloomington community very well without injury for many years, and it's my hope to continue to do that.
I agree. I just wondered if we had any knowledge of what other communities were referring to when they said they banned chokeholds in their communities. If we don't know what the information is to that, that's fine.
Yes, sir. I would not want to guess.
Mr. Mayor, if I could, I just I pulled it up here quickly, and I referenced this was a MinPost article just to Councilmember Beloga's question. And this MinPost article refers to police departments and sheriff's departments that do not allow neck restraints or chokeholds. So that just to clarify, and that this lists Anoka County, Austin, Brainerd, Brooklyn Park, Duluth, Fergus Falls, Mankato, Moorhead, Rochester, Sartell, Sherburne County, St. Louis County, St. Paul, Stearns County, and the Minnesota State Patrol. That's, I'm sure, not a complete list, but that's from that MinPost article, just to add some clarification to that.
Well, thank you, Councilman Coulter, but the language there was not clear to me that it said vascular neck restraints. Because I
neck restraints and
both received vascular neck restraints and applied them. And I, like the sergeant, have not had any negative reaction personally as a result. And I heard you say chokeholds and neck restraints rather than vascular neck restraints. Maybe I misheard you.
You said chokeholds and neck restraints. It didn't specify vascular neck restraints.
Yeah, because it's different. And there needs to be precision in the reporting for us to understand what it is. But Sergeant, thank you for the response. Much appreciated.
Thank you so much.
Thank you, Councilmember Beloga. Council, we've all had a bite at the apple here, so I think I'm going to move us along. I know we've asked a lot of questions, gotten a lot of good information. I think there's some follow-up information that folks have requested and we'll be looking for. But once again this evening, a very good discussion, and I appreciate Chief Potts and Officer Seifert and Sergeant McHarg for helping us out this evening, answering the questions. Greatly appreciated, and your time and your willingness to stand and answer through all the questions. It is appreciated, and it shows that your willingness to not only walk the walk, talk the talk, the whole bit. You're willing to stand up and talk through this with us, and we really do appreciate it. I think that says a lot about you. Thanks much for that. I appreciate it. So,
Mayor and Council, I appreciate it as well. Thank you.
absolutely. Officer Seifert, you're off camera right now, but thank you. Chief Potts, thank you as well.
Thank you. Thank you again for the opportunity to participate in the conversation.
Thank you. With that, Council, I'd like to call item 2.3 on our agenda this evening, which is Racial Equity Business Plan Review and Discussion. And our Racial Equity Coordinator, Faith Jackson, will be leading us through this. Ms. Jackson, thanks for sticking with us this late into the evening. Greatly appreciated. And welcome. Look forward to our discussion about this as well.
Thank you, Mayor. Happy to be here to have this timely discussion. I'm going to attempt to share my screen so I can pull up a presentation that will guide us through the discussion tonight. Can y'all see it?
Yes, we can.
Perfect. So I am going to jump into discussion. I know time is far spent and it's late in the hour. But I want to acknowledge at the very beginning of this discussion that I have a lot of information to cover. And so we will take some time here tonight to get through everything. But the conversation that we're having tonight is both timely and extremely important. And I say that it's timely because over the last several years, many government agencies have begun doing the work to prioritize racial equity and to make that a strategic focus within their organizations. And then over the last several months, there has been a demand from community, both globally, nationally, locally, here in the state of Minnesota, and also within the community of Bloomington, for government agencies to do more in terms of moving the needle and really begin to advance the issues of racial equity. Having stated that, it's important to note that issues of inequality and injustice and discrimination are not new. Unfortunately, our country was created on a system of inequality, and the government bodies that we have now were also created within those systems. And so we have centuries of injustice to tackle when we talk about how do we move the work forward and really advance racial equity. And so there's a lot of work to be done, and these are some significant challenges. But as with any challenge, in order to accomplish our end goal, we need a starting place and a launching pad. And so tonight I will present to you a roadmap for how we can move forward with advancing the work. And I'll present to you a plan for how we can start the work, so a launching pad, and then also a plan for how we can be strategic and do some long-term planning. And so I mentioned that I would present a roadmap for how we move the work forward. One of the other things that I'll acknowledge at the beginning of the presentation is that as we move the work forward and advance racial equity in the city of Bloomington, we're doing that while also simultaneously addressing the disproportionate impact that the COVID-19 pandemic is having on our BIPOC communities. And we're also recognizing that there are present issues of community mistrust and civil unrest throughout the country and in the city of Bloomington. And so this plan that I'll present to you will take into account those two important issues and provide a way forward for how we meet those needs and really bring together a comprehensive plan. And so in order to accomplish that goal and really to take into account all those many different things that we're trying to manage right now, I'm proposing that we move forward with a dual approach to advancing this work. And so in creating a bridge to the future and really reimagining what our city can look like in terms of prioritizing racial equity, I'm suggesting that we first start with some rapid response efforts. And so that really speaks to moving forward and acting with urgency to do the things that we know, right, and address those known needs. And then also combining that with some phased and intentional planning that requires us to slow down and think critically about the future that we want to create. It requires us to listen to community and not just listening, meaning they speak to us, but actually hearing and believing and understanding what they're saying. It also requires us to learn from community and learn from our community partner organizations, and then to take that information that we've heard and those things that we've learned and really move forward in building a strategic plan. And all of that work will lead us to this place that we want to be. And so we have here on the screen a statement that says, we're becoming a vibrant, safe, and healthy place where people of all races strive. And you'll recognize that language from the city's racial equity commitment statement. But I've added in here some additional language. In the end of this, it says, and the community will lead us there. So throughout this presentation tonight, you'll hear me speak a lot about what it means to be community-driven and community-informed. And that will be an underlining theme of all of the things that we discussed tonight. So to provide some context for how we'll spend, I imagine, the next 2 hours or so, I'll begin with a short video that will provide some context for how racial equity work came to be in the city of Bloomington and highlight some of those ongoing initiatives that we're doing right now. And in doing that, this video will really highlight the things that the council may not be aware of. Then I'll present a roadmap for how we move forward, starting first with our rapid response measures. And so looking at the things that the city is doing to mitigate the disproportionate impacts of COVID-19. Also, I'll introduce to you and propose to you a new model for rapid response community engagement that will allow us to take in suggestions and questions from community and then report back to them and implement their suggestions in real time. Then we'll spend some time really going through the racial equity business plan and reviewing the 4 focus areas and the goals and the needs and the strategies included in that plan. And then I'll spend some time giving a high-level overview and presenting you a roadmap for how we can do more strategic long-term planning and really bringing together the work that involves racial equity and then the broader scope of equity and inclusion within the organization. And then I'll end my presentation by going through some of the challenges and opportunities that we have as we think about how do we do this. So what are the resources that are needed to do this work, and so what are the opportunities that we have to move forward? So at this point, I will stop speaking and we will share with you a quick video that will introduce this work, and then we'll jump into the meat of the presentation.
Racial equity has become a strategic priority for the city of Bloomington, and that work has really evolved over the last 5 years. And in this video, you will really hear from people who, unlike me, don't have racial equity as the core charge of their work, but they're finding ways to advance the work within their own sphere. Now, unfortunately, it's impossible for us to share information about everything that's happened within the organization, and there are many people who are doing that work. So this video really focuses on those who are doing things that the community may not be aware of, right? And so those everyday things that are happening in order to advance the work of racial equity.
We've learned a lot over the course of the last 5 years. And one of the things that we have learned is that utilizing outside consultants or doing this work on a sporadic or an inconsistent time schedule is not going to serve the community well. As a result of that, last year the City Council decided to hire a racial equity coordinator, a person who would be working for the city every day to make sure that the systems and the structures that we have at the City of Bloomington are meeting the needs of our community, that are helping move forward our organization in the space of racial equity, and helping the City Council and the city staff develop the competencies that we need to relate to everyone in our community. Many people will ask the question, why now? The imperative is not new. The imperative has been there for many years. Minnesota, despite being a leader in so many areas, has actually been a leader in so many areas for white people. Minnesota has among the worst disparities in the country when it comes to educational achievement and when it comes to things like employment and housing. In those areas, people of color do not have the same opportunity as white people. The urgency of today is being felt because policing is in the news. It's not just policing. I mean, we are experiencing simultaneous crisis in the area of the pandemic and seeing how the disparities of our health system is affecting people. We are seeing how the economic impact is having a disparate impact on people of color. I mean, the way that all of these forces are hitting our community at the same time is only exacerbating the institutional and systemic racism that's already been in place. We have an urgent community need. If Bloomington is going to be successful as a community, if Bloomington is going to be a place where people want to come to live, or if they're going to stay here to live, we need to address these issues, and we need to do it together.
I would say for the last 4 to 5 years, the executive leadership team has made racial equity a focus of its work and the time we spend together thinking about things here at the city. That's involved going to training together, hearing different speakers. We've done some reading from books and discussion around those books to help us each expand our knowledge of the issues and share some of our different perspectives and experiences.
We wanted to make sure that we were attracting and recruiting employees to the city of Bloomington who reflect our community. It's really important that our residents see themselves represented in the people who are serving them at the city level.
So we have refocused a variety of things HR related, from where we advertise jobs and how we advertise jobs to what the minimum requirements are in our job descriptions to hold a staff position here. A good example of that would be that historically the city has always said that it would be desirable to hire somebody that has worked for another city or county or already has that experience in government. But when you look at the public sector workforce and how non-diverse it has historically been, if we're giving preference to people who have already had work experience in the public sector, we are not advancing our racial equity goals. We're just perpetuating the same demographic in the public workforce. So we've had to really ask ourselves, what are the specific skills and knowledge that we're looking for in people, and consider multiple ways that people might have achieved or acquired that skill or knowledge.
Our Community Outreach and Engagement Division has been focusing on the BIPOC population because when we look at health statistics for COVID-19, our Black population, Indigenous populations, and other people of color are disproportionately impacted by the pandemic. And so our focus is making sure that those populations have access to timely information, access to resources and things to help alleviate some of those disparities that are emerging in the data.
The governor had asked the public to make masks and bring them to their fire stations. So we distributed a bunch of those to long-term care facilities in the city. We also distributed some through churches, and we've also distributed some through other means to reach out to people who wouldn't ordinarily be able to have access to one. Especially during that period of time when we were kind of on lockdown and everybody was encouraged not to go out, and there's a fair segment of the population that doesn't have the ability to get online and order things, either because of economics or broadband access.
We always think we have the answers and we know what the kids want, but we never ask them what they want. The great thing that Faith came up with this town hall is to empower young women and men of color to not only take leadership roles, but also to look themselves as relevant. We're trying to bring kids out of the shadows of not being comfortable to talk around their peers or talk around people in power, and give them an opportunity to basically voice what they've been feeling and not been saying. And so this is a way for us to basically empower our young youth in the city of Bloomington to be the kings and queens that they are. In the age of COVID-19, in the age of social unrest, we have to be innovative in the way in which we address programming and provide programming to folks that we're trying to serve. Doing things as business as usual is great for us and it's comfortable, but it's not innovative.
It's important to the water resources team in the city of Bloomington that the residents and communities across Bloomington have an equitable ownership of the water quality, quantity, amenities, and ecology that exists within our city. Youth are a targeted group in this community because they are the future water stewards of the area, and they will probably have the biggest impact over the long term in water stewardship. They also have a particularly strong voice in how we can interact with the community and setting that up and building a foundation for the future. And so water in general is a really complicated world, not only in the science of it, but the infrastructure and the government of it. It's also important for us to target youth because we want to build a blueprint for them to get into the water world, and it exists so far behind the scenes on many occasions that having them on board now can show them a path to work in the water world and hopefully maybe work for the city of Bloomington and preserving our water resources for future generations.
Regularly in the summer, Parks and Recreation offers a free lunch program through our Summer Adventure Playgrounds program. But even without this program, we want to be able to offer nourishment to our youth, specifically on the east side. At Smith Park, we believe that we'll be able to reach additional BIPOC community members with our free lunch program and hopefully get them involved in our Parks and Recreation programs at the same time.
It's even more difficult for most people to understand having your kids go hungry because you can't hardly afford housing, and so it becomes very important that those kids get supported nutritionally, because that is such a huge factor in their lives and their development.
34% of all people that live in Bloomington are renters, so that's a pretty significant population that we're missing if we're only focusing on homeowners, whether that's intentional or unintentional. And among that 34% of all residents, you've got the African American population, for example. Among African Americans, all African Americans that live in Bloomington, nearly 90% of them rent. And so when we're trying to capture that population in our programming and our outreach, going to rental housing is a really great place to capture them, because it's capturing people where they live, and it's engaging them in a way that I think a lot of cities and local organizations haven't really thought to do that before. So it was through this outreach to property managers for our tobacco work that we really started getting a stronger sense of what the conditions were on the ground. And there was one property in particular, Southgate Apartments on the east side of Bloomington. It's a 7-building property, 244 units. We estimate like 800 to 1,000 residents there. An incredible property manager who's just engaged with the city in so many different ways. Through that kind of relationship building with her, that we really gained a deeper understanding of the conditions on the ground and how the city in a lot of ways was failing residents. And so we were seeing our clients in public health, we were seeing people interacting with the criminal justice system, we were seeing people that were having issues in securing housing, being able to afford their housing, and being able to get their needs met when it comes to making needed repairs in their rental housing, and being able to just have healthy housing. And all those people were having all these different touch points with the city, and none of us were coordinating our work together. And so we really realized that that it was necessary, that the onerous, the work is on us as a city to try and figure out how we make our programs and services more accessible to that specific population. What I started doing is convening different city departments and just having meetings on site there. We realized that we needed to expand our group beyond just city departments and also include folks like VEEP, the early childhood services, Bloomington Public Schools, all these other kind of major institutional players that are also having touch points with these residents.
Research has shown that BIPOC and low-income community members experience the effects of climate change to a higher degree and are the first ones to experience these problems, often called frontline community members.
So we know that it's really important that these community members have a voice at the table because they're the ones that are seeing these problems firsthand right away and have the perspective that will be able to help us be strategic and really address the issues that are facing us currently and in the future. I've also been working with Centerpoint Energy and Excel Energy on gathering conservation improvement program data specific to Bloomington. And for the first time, we're looking at this data by census tract. So we not only see how many program participants there are, but also where in Bloomington that participation is happening. And that can help us make program access more equitable if we see that there are gaps in participation.
So it's also important to us that we're very intentional about working with artists of color and BIPOC artists that are representative of our community. And so we've really been very focused on making sure that we're sending information to the right organizations or people, making sure that it's an inclusive, very approachable and accessible application process, and in turn involving the community within these projects however we can so that they see themselves represented throughout the process and so that they're involved and feel more ownership of those projects.
Having children see themselves in the mentors or the teachers or the individuals that they're engaging with for meaningful experiences is really important because it helps them not only engage in the process and engage with the people, but it helps them see themselves in that future role.
In the police department, we're very committed to continuing our work in racial equity. It starts with hiring. Hiring police officers in the police department is challenging. We also understand that the demographics in our community are changing. And so we are, for the past 3 years, using a Pathway to Policing program to help us become more diverse and match our community. This program has been underway for 3 years. It's been very successful, and we continue to do that, again, as an effort to try to match the demographics of our community. The second thing is our training. Every year, our officers are required to complete implicit bias training, procedural justice training, and we are continue with that training and even make that training even better. Our officers are required to do that for their police officer's license, but we are double or triple what is required by the state of Minnesota for police officer training. The third thing is we are a partner of the Joint Community Police Partnership Program. This program is 5 or 6 cities in Hennepin County that have come together to help build better relations with our multicultural residents. It includes a community liaison. Her name is Caitlin Goki. She manages a MAC, which is a Multicultural Advisory Committee, and those committee members are members of our community from different ethnic groups, and we really rely heavily on them to help us develop policy, help us build relationships in the community, and do so many other things through this program. And we're continuously trying to improve that program. And I'll leave you with this. The police department is continuing to get even better in the future. We know there is more work to be done.
Doing this work, it's not a plug and play kind of strategy that we have to implement. It's a surround sound approach to meeting people not only where they're at, but also creating lanes in which people can change their minds.
So now you've heard from many people who are moving the needle and really working to advance racial equity work within their own sphere and from where they sit. I'm so grateful to have the support of this team because this definitely is a team effort. Moving forward, we'll begin implementing our racial equity business plan in the city of Bloomington and then continue to reach out and engage the community so that we can hear from you. How do we advance the work and how do we become that city where people of all races are able to live and thrive?
So, as mentioned before, I wanted to start this discussion tonight by highlighting some of the ongoing work that's being done to advance racial equity. And in that video, we highlighted some of the things that we don't always speak about or discuss in council meetings. But again, that's not an exhaustive list, right? So there are many different things that are happening across the organization already to advance racial equity. And so I want to thank the communications department and specifically Emily Taplin for pulling that video together. And it will be available on the city's YouTube channel in the upcoming days. And so at this point, I want to jump into the roadmap that I discussed first before and really starting with those rapid response measures. So what are the things that we're doing to address those urgent needs that we already know of? One of the things that the city of Bloomington is keenly aware of is the disproportionate impact that the COVID-19 pandemic has on BIPOC communities. And so early on in our response measures, we decided to prioritize racial equity. And so we did that via mayor proclamation. In addition to that, we have utilized a racial equity impact assessment as we reviewed changes and made emergency management decisions. Um, Even still, with sort of those proactive measures in place, emerging data highlights that in Bloomington there is a significant impact on Black, Indigenous, and people of color communities. And so data from our public health department shows that 30% of our cases are in BIPOC communities, 19% in our Black community, 14% in communities that identify as something other than Black, American Indian, Alaska Native, and or white, and then 2% in the American Indian and Alaska Native communities. And what we see in this data is that not only is there a significant impact on BIPOC communities, the numbers here are disproportionate because they don't really speak to the amount of people that we have in that population. So, for example, our African American population is around 8%, but you see here that they're represented at 19% in terms of cases. Also, when we look at the data and disaggregate it by ethnicity, we know that 32% of the cases in Bloomington right now are in the Hispanic community, or there are people who identify as Hispanic. And so, unfortunately, while those numbers are troubling, they're not necessarily surprising. And that data correlates with the information that's provided by the CDC. And you'll see there's a map on the chart, and you may remember this map from the presentation I did with the council back in January. And at that time, I spoke about how the CDC has this data, which will be able to demonstrate to us where are the most vulnerable communities within our city. And the data that speaks to where we're seeing cases with the COVID-19 pandemic really correlates with that data that we had from the CDC before this pandemic, and really determining where those vulnerable communities are. So with that in mind, one of the rapid response measures that the city has in place is efforts to mitigate the disproportionate impact and really prioritizing racial equity in our COVID-19 responses. And so here on the screen, I have a list of things that the city is doing to mitigate that impact. Again, this too is not an exhaustive list, right? There are many things that are happening, but I'm highlighting those things that are directly connected to mitigating those impacts. And so I'll briefly go through the things on this list and provide some context for them, and then I'll stop and take some questions after that. And so the city is providing rental assistance through a partnership with FEEP. And in that work, we're really looking to prioritize those members of the community who aren't able to receive resources from other agencies or have other opportunities for rental assistance. In addition to that, the Community Development Department and our interim director is really paying attention to what are the housing concerns. And so just today, there was work on the state level to continue the moratorium on evictions. And so that was extended for another 30 days. And that's an opportunity to provide renters protection. But we know that there are some concerning things for us to think about in the future. And so what we're trying to do is to continue to work with our partners to provide rental assistance, but also thinking about what are the other things that we can do to protect our community and prevent an eviction crisis in the city of Bloomington. And most recently, our community development department has really started to think strategically about how do we partner with community organizations who already have embedded trust in our BIPOC communities, and how do we work with them to address some of those housing concerns. Another thing that, and I'll talk about here quickly, is our food distribution and mass donations. And so those things were covered in the video that we watched together. And here the city is working in collaboration with the Bloomington School District, and our fire department is delivering meals to those students and family in needs. And in addition to that, we did a donation drive working with stakeholders in the community, namely faith-based organizations, and we're able to donate masks to elderly facilities, so senior facilities. And then also we got requests from various community leaders, particularly in our BIPOC community leaders who said that there was a need for masks. And so we were able to deliver those. And we continue to think about how do we prioritize that and how do we respond to those needs as the pandemic continues. Another thing that we're doing to mitigate the disproportionate impact is we're providing information on mental health resources to our community. And many of the things included in sort of the emails or conversations that we're sending out highlight those cultural specific opportunities and information about mental health resources. And so we understand that all of the things that we're experiencing right now have detrimental effects on our mental health. And we're trying to be intentional about making sure that we provide our community with the information and resources that they need to be healthy. In addition to that, the city is developing a small business assistant loan program. And in the development of the program, the work group that was pulled together to think about how we create this program really was intentional in thinking through what are the barriers that BIPOC business owners face, right, in participating in programs like this. And because of that thorough investigation and acknowledgement of what barriers could be in place, we were able to design a program that really worked to eliminate those barriers and ensure that the small business assistant loan program that we create in Bloomington is one that is equitable and accessible by all business owners. In addition to that, in the Public Works Department, they are providing opportunities for those who have been financially impacted by the pandemic to have resources in terms of loans and grants for assessment costs. We've also suspended late fees for garbage and recycling services. And here within the last 2 weeks, the Community Budget Advisory Committee has made a decision to utilize a racial equity impact assessment as they think through suggestions on budget implications to the council. And so they'll be utilizing a racial equity impact assessment as they think through and move forward with their work. And so here now we have a list of some of the things that the city is doing to mitigate that disproportionate impact. This work is always evolving. So as we see opportunities to do things differently or really be preventive and proactive, we are engaging in that. But I'll stop right now at this point in the presentation and just take some questions about either things that you heard in the video or the efforts, the work that we're doing to mitigate the impact on BIPOC communities in terms of the COVID-19 pandemic. And then any questions that you have about the sort of 10 or so items that were on the list previously before this. I'll answer some of those, but I want to acknowledge on the front end that many of those programs are being led and driven by all across the department. So if there aren't questions that I can answer today, we'll just have some additional responses provided by the respective leads at a later date. And so I'll open it up for questions.
Council, questions to this point?
If there are no questions, then I'll continue.
Seeing none, I would say onward.
Thank you, Mayor. The other thing that is an urgent and known need and that we recognize in the city of Bloomington is that there is a need to address the issues of community mistrust of government and civil unrest in our community. And so in the wake of the tragic death of Mr. George Floyd, the community is asking, in many cases demanding that we tell them, what are we going to do, right, to mitigate the chance of something like this occurring in Bloomington. And the death of George Floyd occurred in a neighboring city, so it has sort of a unique effect on the people in this Trans-Cities region. But it's important that we recognize, and I want to be clear, and that the issues of sort of injustice in the criminal justice system, issues of police brutality, et cetera, are not unique to Minneapolis, right? And so while we're affected and connected in terms of geographical location, these are also issues that are important for us to discuss within the work that we do and within the city of Bloomington. And so the community is really expecting a quick response And in many cases, people have already started to provide suggestions and thoughts about how we can move forward as an organization. And so I know that many council members, like myself, have received questions from community members and have received proposals on how we move the work forward. So what I'm suggesting is that we develop a rapid response model for community engagement. And this model will work in collaboration with the co-ed work that we already have in place. And so the suggestion is that we create an intake box on the racial equity web page that would allow us to take in those questions and suggestions from community. And then when we receive those questions, suggestions, I will work and do some cross-departmental collaboration on to get questions answered in sort of real time and get that information back to community. And then also take in those suggestions and think about what can we do to address those things that are feasible and quickly implemented. And where there are opportunities for us to take proposals and suggestions and begin to quickly implement those things, we'll do it. And those response measures can be used in collaboration with our co-ed division, but also any respective departments who have the ability to act on those suggestions. And then we will continue to report out and report back to community either on a monthly or quarterly basis those questions that we've received and the answers that they need, and then also what have we done with their suggestions, and really allowing the community to see sort of the fruit of the work and their investment and bringing questions and suggestions for the council. And so I'll present to you an example, and a simple example, but an example nonetheless of how this has already started to form in the city of Bloomington. So a few weeks back, I received a call from a community member who informed me that they were a member of an African American church that was displaced through the closure of the Creekside Community Center. And so this church had space in Creekside, and because of the closures there, they were displaced. And as the restrictions were being lifted and the churches were able to gather again, and then in the wake of the tragic death of Mr. George Floyd, there was a need to reconvene the congregation. And so they reached out to me to see if there was anything that the city could do. And what I did was I worked with Oceanside Community Service Department and our Park and Recreations Department to see if there was anything that we could do to address this urgent need. And it was determined that we had the ability to work through our volunteer network and put out a call, right? A call to action to those local churches that we have relationships with and see if there was anyone who was willing and had the ability to share space. And thankfully, our co-ed department was able to place that call to action, and we had responses back. And we were able to find a space for that church that had been displaced. And after that, I followed up with the initial caller to make sure that they were sort of satisfied with that outcome and made sure that they knew that they could reach out to the city with questions and concern about issues of racial equity and or the things that they were experiencing. And so, in a way, we're already operating in a sort of rapid response model, specifically as it pertains to racial equity issues. What I'm suggesting here is that we formalize that process and really stand up the structure to make sure that those questions and suggestions that are coming in, both to staff and the council, are not left in an inbox, right, and unattended to because we get so many of them. But we're really sort of providing and streamlining that work into one place, and then making sure that we're acting on those things that we can do and following up with community in a visual way. And so, again, I'll stop now here to take any questions about the rapid response community engagement model that I propose.
Council, any questions regarding rapid response to community engagement? I see Councilmember Nelson's hand up.
Yeah, thank you, Mayor, and thank you, Ms. Jackson. Just a quick question in terms of the reporting out to the community. You indicated that may be monthly. What type of format would that be in? Would that be something on our website? Would that be at a council meeting, a video through social media? How do you see that occurring?
Ms. Jackson.
Thank you, Mayor. Councilmember Nelson. So right now, I envision this to be a report out in visual form, so a video, working with our amazing communications department to get those videos out. And the reason why I've chosen a video format is because then we can easily adapt that and share it on our website and our social media pages and things like that. And then also send that out directly to community organizations so that they can share with those in their network. But I like the idea of also sharing those report outs in council meetings, or maybe connecting them in some way to the council minute that we do. And so I think there's a lot of opportunity to think about how do we get that information out to community.
Councilmember Carter?
Thank you, Mayor, and thank you, Ms. Jackson. So my question was very similar, except for it was more on the front end, and wondering how we are going to make sure that we are communicating this opportunity to community members, across the city. And then one comment, which I assume then it's probably very similar channels. And then one comment would be, wondering if we have the ability to have more information in some of our communications pieces translated. And I don't know what that all entails in terms of like how that would work for videos and things like that. But I do know we have a large Spanish speaking population. And so wanted to ask that question.
Ms. Jackson?
Thank you, Mr. Mayor and Councilman Carter. So yes, we have the ability to translate videos. What we do right now, what I believe we do right now, and I can follow up if any of this information is inaccurate, is we translate the transcript that's attached to the video. I don't know if we have the ability to do closed caption and sort of add those translations and embed it into the video, but that's something that I could reach out to the communications department and find out if we have the ability to do that. But I would say that we've definitely recognized that as a need in the city of Bloomington. And one of the things that, wasn't listed, I mentioned that list before wasn't exhaustive. One of the things that we did right away, right, in attempting to mitigate the impacts of COVID-19 on our BIPOC community was really rethink the way that we were sending information out to communities and doing that in different languages and doing sort of radio tours with our BIPOC media outlets and making sure that information was getting out to people and really meeting them in the places where they already gather, right? As opposed to just placing the information on our website and assuming that they will come that forward. And so I would imagine that we would take similar measures in getting this message out to the community.
Thank you. I don't have any other questions, but I do want to thank you for pulling all this together, and I'm really excited about it because you are right. We are getting a lot of emails and requests, and it will be nice to have a way to systematize or a place for like all the requests to make sure they get addressed. And so thank you.
I appreciate your answer to the last question, Ms. Jackson, especially as it regarding the intake. It looks rather passive to just do intake, but to do it in an active manner, as our co-ed team has been doing or has been developing over the past year or so, I think would be an effective way to fill up your racial equity suggestion box without simply waiting for the suggestions to come in. So I'm glad to hear the answer to your last question. I see Councilmember Martin's hand up.
Thank you very much. And if this is a topic that we'll get to in a moment, please let me know. So if we are hearing maybe a lot of the same suggestions coming into that box, but they would take kind of larger structural action on the part of the council, say something like an ordinance change or large changes to procedures and policies, are we kind of acknowledging those in the moment and then batching those for council consideration? Maybe when we're looking at work plans at the start of the year, or how are we responding quickly, especially to the really big ideas that we're going to get here?
Ms. Jackson.
Mayor, Councilmember Martin, yes, I believe that. So one, we would take in those things that require more additional work, so policy changes or more structural changes. And in the analysis phase of this presentation, of what I presented here, that information will be shared with the appropriate departments. And so that'll be the first touch point. We'll take all of the information and share it with the appropriate department, regardless if it's something that can be done quickly or easily implemented, so that the departments will have that information. But I also intend to go back and report out to community. These are the things that we've done, and this is why, because they're easily implemented, or these are things that aren't feasible, and provide an explanation for the work that we're doing, and where there are things that are feasible but not necessarily quickly implemented, making sure that we acknowledge that to community, and then those things will be adapted into department work plans. And then if they aren't able to be done in sort of the immediate future, like a 1 to 2 year process, then we can move those things into our long-term strategic plans.
Thank you very much. I appreciate it.
Any additional questions on rapid response community engagement? If not, Ms. Jackson, please continue.
Thank you. So one other thing that I want to acknowledge here before I move on is that this model relies heavily on the great work that our community outreach and engagement division does, and they've been really instrumental in moving the racial equity forward here in the city of Bloomington. And so I just want to acknowledge that while this is sort of the rapid response model, and something that will live on the racial equity webpage, it really requires hard work, both from our department leaders and then also that co-ed division. And so at this point, I just want to move forward in doing sort of a deep dive into the racial equity business plan that you have before you. And so you may recall the information in this plan was first presented to the council back in March. In early March, we were set to review this plan during a council study session. I believe it was March 16th. But that council study session was postponed as we made a decision to start to address the necessary and immediate emergency management responses to the COVID-19 pandemic. And so this racial equity business plan that I present today is not something that we've created in response to the things that are happening around us. And so I'll go through that, and I'll talk about, what's in it, what it contains, what the goals are. And then we'll talk about how we build a more strategic plan that reacts to some of the things that we're seeing right now and is more community driven. And so the racial equity business plan has 4 focus areas. The first focus area is workforce diversity. Here, the goal is to ensure that we have a workforce that mirrors the population that we serve. The second focus area is training and professional development. And so here, the goal is to make sure that racial equity is a staff competency, and that all of the City of Bloomington employees feel confident and competent in advancing racial equity work, and doing that from the level that they sit. So really understanding how to apply a racial equity lens to their work. The third focus area is programs and services. And so this really speaks to making sure that there are equitable outcomes in the services that we deliver. And this requires the development of strategies that will reduce racial inequities. So essentially utilizing those racial equity tools to ensure that we improve success for all residents. And the last focus of the racial equity business plan is authentic community engagement. And here, what we're seeking to do is really engage the communities who are most affected by racial inequities, and really fostering a way to ensure that there's shared learning, that there's shared understanding, and also that there's shared power with community. And so the racial equity business plan that I put forth today really builds on the GARE model, so the Government Alliance on Racial Equity, of putting theory of change into action. It also builds on resources from the League of Minnesota Cities, and also from the National League of Cities, and other work plans that are being used both here locally throughout the Twin Cities and across the country. So I want to acknowledge that this isn't a byproduct entirely of just things and ideas that the executive leadership team and I have, but really builds on existing work throughout the country. And so you have a copy of the business plan before you. And so I won't go through it and pull it up here on the screen. What I'll do instead is sort of highlight different things from each focus area. But the business plan is about 3 to 4 pages, and it acknowledges the goals. So it really gives detailed information for what it is that we want to do in each focus area. And then it describes why that's important, right? So why these things are important for the city of Bloomington, And then it goes into the strategies and lists out the things that we need to do in order to accomplish the goal. And then it also provides benchmarks for how we move forward and how we track our progress. And those performance measures are included within the plan. So I'll start with the first focus area, which is workforce diversity. And so again, here the goal is to increase the diversity of the workforce so that it mirrors the population that we serve. Currently, the city of Bloomington workforce population is about 90% white, but our racial demographics in terms of breakdown of the communities is something around 70-30, right? And so our workforce does not represent the population that we serve adequately. And so it's important that we have a workforce that really mirrors the population that we serve and that has representation from all community members. And the reason why this is important is two focus. So one, sort of at the creation of America as we know it in our government system, there was this idea that government should represent the people that it serves. Unfortunately, in our country, for many years, government either implicitly and explicitly prevented those people who were non-white from holding jobs within government. And so, as a result of those historical inequities, there's a lot of underrepresentation in government right now. In addition to the moral obligation to make sure that we represent those people that we serve, there's also an issue of a workforce shortage. And so, what we know is that over the next several years, as many people within our community and within our workforce community begin to retire, that we will need to acquire new talent. And the talent pool here in the Twin Cities is a lot more diverse than it was 20 or 30 years ago. And so, in order for us to remain economically competitive, we'll have to do the things that are needed to attract that future workforce of BIPOC community members. And then also, it's important for us to have that racially diverse workforce because we need representation in our community. For example, one of the things that we heard Chief Potts talk about in terms of making sure that people see them in the police officers, and we hear this for many different department areas, but a lot of those frontline and sort of public-facing departments, the community wants to see themselves, right, within the city of Bloomington, and it's important that that representation is had, and it will also help us to address some of our racial equity concerns. And so if we have that expertise within our own department, then we don't have to necessarily always go out and collect that information from experts or other organizations. And so now to strategies. I have here listed on the screen, again, this is not an exhaustive list of everything that's included in the racial equity business plan, but some key points around how we meet that goal. So the strategies for accomplishing this goal is one, commitment. And so making sure that we have that commitment both in words and in deeds and in policy to prioritizing racial equity in our hiring and retention processes. It requires us to do proactive recruitment and have proactive recruitment strategies. And it also requires us to work in collaboration with partners, right? And so, really thinking about how do we get the information out to those organizations who may have applicants for the jobs that we have. It requires us to use racial equity as a core competency and value in our job descriptions. It also requires us to think strategically about how we remove barriers from opportunities. And so, in the video that we heard at the beginning of this discussion, we heard from the Assistant City Manager, Chris Wilson, and she talked about how there were changes made in sort of how we determine who the best applicants are and really moving away from saying, well, you have to have that previous government experience because we understand that that can be a significant barrier against the backdrop of the historical racial inequities that we have in that space. And so that's a real life example of what that will look like. And so those are the strategies that we would implement in order to accomplish this goal. And so in terms of measurement, right, how do we track effectiveness in this area? We would look to our data. So I mentioned before that we're like 90% white, and so we'll be looking at our applicant data to see where is their movement. We'll be looking to our new hire data, right? We know that we have the composition. So our composition as it stands now is what it is. And so also paying close attention to new hire data and not just relying on sort of the broad data that looks at the organization as a whole. We'll look at resignations, internship positions, leadership positions, and really looking to see what are those revised job descriptions and which departments are doing the work to be intentional about removing those barriers in their job descriptions and what does that language look like. And so these are some of the things that we can look to in terms of measuring our success in these areas. And so originally I had planned to go through all of the focus areas and then come back and sort of have a group discussion around questions. But if there are any questions about this particular focus area, I'll stop now and take those. I think that may be more helpful than saving all of the questions until the end.
Councilmember Lohman, question?
Thanks, Mayor and Ms. Jackson. So on an earlier slide, you had something with the idea of staff competency. Could you help me understand kind of what that means in terms of, will it be trainings? Will it be, will it be linked? I mean, how will that be operationalized in terms of that competency? How will we know that we have achieved the competency?
Ms. Jackson?
Thank you, Mayor and Councilmember Lohman. So I'll answer your question in two ways. I'll start with how do we define racial equity as a core competency and as a staff competency. So what we're looking to do is really ensure that staff understand the work of racial equity and that shows up in their actions as employees, similar to the way that we look for other competencies, whether it's maybe it's a specific training that you need or we're looking for you to be able to, I don't know, lift 50 pounds if you have a certain job. All those sort of requirements for the jobs that we have, racial equity as a competency will become one of those requirements. And what that looks like is, do you have the ability to work with people who are from racially diverse backgrounds? And so that'll be a part of the questions that we ask in the interview process, and that'll be the things that we list in terms of minimum qualifications in our job descriptions. Other things, and we'll require sort of examples of what that looks like. Understanding that any individual who's working for the city of Bloomington most likely will be interacting with people who are from our BIPOC communities. And so really ensuring that staff have the ability both to interact with those communities and also have an understanding of the different challenges and racial inequities within our organization and within our broader community. And to the second point, how do we measure that? So we're starting to do that already through surveys. And so when I started in this role in October, I think on the second week or so, we began implementing the Introduction to Racial Equity training and providing a foundational understanding for what this work is that we're doing in the city of Bloomington, and surveying staff on, do they understand and do they feel like they have the ability to apply a racial equity lens to their individual work and the things that they do. So we have some baseline data that speaks to whether staff believe that they have the ability to do that or do they understand what that means. And then we're also looking at how do we equip them with the tools, right, to develop that competency. And then as we move forward with new hires, really being intentional about making that a center requirement of the work that the employees will be doing.
If I could ask a couple follow-ups here. So do you foresee that at some point in time that we would link this to compensation in terms of how this is operationalized as well?
Ms. Jackson?
Mayor, Councilwoman Lohman, I would need a bit more information from you in terms of what you're describing in order to answer that question. Could you provide us some additional context?
Let's come back to that. I think I'll hit it in a different spot because let me ask this one first. On one of the other slides, you mentioned authentic community engagement. What does that look like? I hear engagement, but when I hear the word authentic, I like that. It just sounds really, it sounds like it's more, to the heart, and I'm just wondering what that looks like in terms of of an engagement that brings people into the process. So what does that look like if I were to be a part of this authentic engagement?
Ms. Jackson.
Mayor and Councilmember Lohman, if you don't mind, I'll save that question to our first slide because the authentic community engagement is a focus area, and then I'll dig in deep there in terms of what are the strategies and goals and values there. Is that okay?
Yeah, that's great. Yeah, that's just like my other question piece. Then the last piece for me is when I look through these things here, I see new hires and I see resignations and that type of thing. So it leads me to believe that we're going to utilize some retention strategy. And will that be a part of the overall goals and objectives in terms of because one of the things I get concerned with when I see certain with plans like this, that I think we should just be cognizant of as we look at this in terms of concentration of folks in certain areas of the business, and then also just retention and just paying attention to trending that we're seeing along those trending lines in terms of retention. I'm not necessarily looking for a response from you, but just something that I'll be interested to see how you deal with that over time, with that retention piece and strategies that other governmental entities utilize in order to achieve this overall goal.
Council, any other questions? Hearing none, if we could move on, Ms. Jackson.
And so the next thing that we'll discuss, really, Councilmember Lohman, this sort of is a perfect segue from your question to the latter part of the conversation. Here we'll talk about inclusive culture. And so what we know is that it's not enough to bring in BIPOC members to our workforce and really diversify our workforce and put all of our eggs in one basket there. If we're not doing the work to make sure that those people that we're bringing in, we actually retain. And a major component of retaining those individuals requires us to create an inclusive culture and making sure that the environment that those employees come into is a safe and supportive environment, and that they find these spaces to be welcoming spaces. And so the second focus area of the Racial Equity Business Plan, our primary goal is to create and support an inclusive culture that values and advances racial equity. One of the reasons why this is so important, right, is because, going back to what I talked about before, we're thinking about that workforce shortage and how do we move forward and how do we be economically competitive? Well, if we're going to bring in that new workforce, we want them to stay, right, and not leave after a year or two. And so ensuring that we have a safe and welcoming place and then will help in terms of retaining them. Also, it's important because creating this inclusive culture also sends a message to our existing staff, right, that there are some rules and regulations and responsibilities, and really sets the standard for how we want to engage as a city and in what type of culture we will create. And so the strategies here largely focus on training and surveying staff and doing evaluations of those surveys. And so some of the trainings I've listed here in the first bullet point on the screen is cultural competence trainings, implicit bias trainings, and then also doing racism training. In addition to that, we will create racial equity action teams. And these are teams that are department specific. So each department will have a racial equity action team. The members will be volunteers from that department to sit on those teams, and they will adopt a action plan and a work plan that mirrors this plan that I have before you today. And so they will have goals for their workforce and inclusive culture and equitable programming services and authentic engagement. And they will start that work by doing a deep dive and doing an organizational assessment. So really looking at all of the issues and opportunities to advance racial equity within their department. And then I will work with those teams to develop their work plan, and they will report out on that work, both to the ELT, and then I'll report out on that work to the council, right? And making sure that we're not only looking broadly at sort of the aggregate data where we're moving in terms of an organization, but we're being intentional about looking at each department and what work has been done within each individual department to advance racial equity. Another strategy that we have here is learning journeys. And so these are volunteer opportunities for staff to engage in learnings that really help them to understand issues of institutional racism and racial disparities in our community. And they will be created in a method that allows people to jump into the conversation where they feel comfortable. Meaning, so there will be sort of introductory trainings, and there are also intermediate trainings, and then also those advanced level learning sessions. And so I will be working with staff to implement those learning journeys here in the upcoming months. And they will be opportunities for you to review videos, read books, as a litany of different things in order to really gain sort of a broader understanding for this work in terms of advancing racial equity and of the creation and perpetuation of the institution of racism. Another thing that will be important here is implementing an inclusive culture survey. And so this will build on that work that we've done already through our safe space discussions to say, do you feel comfortable and do you feel safe in the workplace, and really dive deep into pointed questions about the culture that we have in the city of Bloomington, both in terms of racial equity and in a broader sense of inclusivity. And so, in addition to that, we will also begin to document, analyze, and address complaints of racial discrimination in the workforce, so that we'll be able to track that information and really understanding, are there any underlying themes or concerns that we need to be paying attention to? And we'll also be incorporating that process into our exit interview process. So making sure that as we have staff exiting the organization, if there are reasons why that are sort of connected to the culture that we have, we understand what those reasons are so that we can address anything that need to be addressed. And so here, in terms of how do we measure success, we will look at training attendance. And so the things that I mentioned, the strategies around cultural competence training and implicit bias training and undoing racism training, all of those will be mandatory trainings for all staff across the organization. The learning journeys are things that are more volunteer. But we'll track attendance in both those volunteer opportunities and also those mandatory trainings. We'll be looking to track the number of workforce complaints, right, to see how many complaints are we receiving and sort of common themes throughout. We'll look at the survey results that come back from our inclusive workforce survey. And then we'll also be looking to the work that the departments are doing through their work plans. So which departments are really moving the needle and implementing those ideas that are put forth in their work plans, and thinking strategically about that. And so again, I'll stop here now just to take any questions that pertain to this particular focus area in the racial equity business plan.
Council, any questions on the topic of inclusive culture? I see Councilmember Carter and then Councilmember Lohman.
Thank you, Mr. Mayor. So my question is really around accountability. And so will all city employees be required to do like the racial equity training? I know some use of the parts of this are going to be optional, but cultural competence, implicit bias, undoing racism, like that will all be mandatory across our city for anybody employed.
Yes, so those will be trainings that we will provide to staff on a ongoing basis, and all staff will be required to participate.
Okay. And then I guess I had another question around the complaint process. So I know that there are like specific descriptions or definitions for what discrimination like includes like legally. Mm-hmm. But I'm wondering, is this going to be more of a way for kind of some more of those issues that may not be like clear discrimination, but are definitely kind of laden with some kind of, I guess I would say discrimination. But I guess I'm not articulating that very well, but I feel like sometimes there is like the legal case, and then sometimes there are just like things that um, make people uncomfortable, but maybe aren't, people don't necessarily feel like they should report to HR, I guess I should say. Does that make sense?
Ms. Jackson?
Mayor Bussey, Councilmember Carter, that does make sense. And here we're looking at both of those things. So both tracking any sort of formal complaints that we receive, and then also thinking about how do we attract those issues that are brought forth to our human resources department that aren't necessarily formal in nature. And this really requires a culture shift within the organization and really empowering staff to believe that they can come forth and share those things with the HR department. And so as we continue to develop the racial equity business plan and implement those strategies, we'll do that in collaboration with our HR manager and assistant city manager, Chris Wilson.
Councilmember Carter, any follow-up?
No, thank you.
Councilmember Lohman?
So one of the things I like about what you have put together here is you can see when you look at the organization and how you've kind of have this laid out here, you've got great horizontal and vertical penetration in terms of your strategy. That seems to be just real excellent in terms of the layout of this. One of the things that I'm wondering about is when we look at the individual that joins the organization and is looking for mentorship and coaching. I know that in the private sector and other places I've seen, they have BIPOC groups that help to support that ongoing vertical and horizontal development of the individual. Do you see that as this strategy that you have both here for these that will, as we look at different phases of maturity with this, I know there's certain groundwork you have to do to kind of get to a certain standpoint where you get a certain critical mass of people to do it. But I'd be interested if you'd have a comment on that at this early stage of your planning.
Ms. Jackson?
Mayor Bussey and Councilmember Lohman, absolutely. I believe sort of employee resource groups are one of the things that are listed in the bullet point in the full plan. It's not highlighted here on the screen. One, for the reason that you mentioned, is that thinking through right now with having such a small population of BIPOC employees, how do we create those opportunities and make sure that there are safe spaces and not necessarily further isolating employees or making them sort of the targets of questions and things like that. And so we are actively thinking about how do we create racial equity initiatives, which include the implementation of employee resource groups. And just in case there's someone who doesn't have a reference point for what those are, these are really just, as Councilmember Lohman described, both in the private sector and in government agencies, there are opportunities for people to connect around common themes of identity. And so, for example, you'll have something like the African American Resource Group or the Latinx Resource Group or the Veterans Resource Group. And so really opportunities for staff to connect around shared identities and have a safe space to interact. And so we are definitely thinking through how we can do some of those things in the city of Bloomington. And I've been having conversations with colleagues in other places, suburban areas who've done this work. I have experience initiating employee resource groups in the city of Minneapolis, and then also supporting the buildup of employee resource groups in St. Paul. But what I've recognized is that will look differently in the suburbs just because the amount of the population, the BIPOC population. So hopefully that answers your question. But I can definitely provide additional information as we begin to utilize.
Excellent. And you actually answered one of the questions I didn't even ask. I was wondering how you were utilizing resources from other places. And that was going to be my next question. So you beat me to it. So very thorough. Thank you.
Thank you.
Council, any additional questions? Hearing none. Ms. Jackson, please move on.
And so the third focus area really looks at our programs and services. And the goal here is for us to utilize tools that would allow us to embed racial equity in our decision-making process, and also really embed racial equity within the structure of the work that we do. And so one of the things that I say in presentations that I give, and I sort of stole this in a way from a former supervisor, is that my goal in doing this work is to work myself out of a job, right? And one of the ways that I can do that is by embedding racial equity throughout all the programs and practices in the city of Bloomington. And so ideally, at some point, this will just become sort of common practice and second nature to the work that we're doing. Now, I started off this conversation providing context for the centuries of racial inequities that we have within the government context. And so, while I would love to be at that place, I don't know if I'll be out of a job anytime soon, right? And so, but one way to ensure that we're embedding that work into everything that we do is to use tools that really force us to think about the work in a different way. And so the strategies here, right, are primarily the use of tools, and I highlighted here at the under the top list here in strategies, the racial equity impact assessment. And so in late January, the council had an opportunity to engage in an activity and walk through what it's like to utilize a racial equity impact assessment, and how using this tool will allow us to think critically about how BIPOC communities are impacted by the decisions that we make, and really mitigate any unintentional consequences. And so what we're doing here with this focus area of the business plan is moving beyond utilizing the racial equity impact for specific projects. I noted before that the Community Budget Advisory Committee will be using that, but really ensuring that that's a process is embedded in all the decisions that we're making across the organization, and that all departments and all staff are utilizing the racial equity impact assessment in their work. In addition to that, strategies here require us to review our internal policies and practices. And so, similar to what was done earlier in the conversation before my presentation, but walking through all of our internal policies and practices and seeing where there are opportunities to advance racial equity. What are the things that are there that aren't needed anymore? What are the things that are sort of barriers or impediments to the work that we're trying to do? This also requires us to look through our legislative agenda. What issues are we putting forth that will advance racial equity? And are there opportunities for us to leverage our power and influence uh, to bolster racial equity in a more regional context? It also requires us to collect, track, and analyze program use data. And so this is something that is extremely important. As I mentioned before in the work with the council, having data that's disaggregated by race is really the starting point for us to be able to understand where do we need to do it and what work needs to be done. Of course, that comes with additional context, but that data disaggregated by race highlights those issues that we need to focus our attention on. And so what we're looking to do here is start the practice of doing customer surveys and finding ways to collect information from customers and the residents that we serve about their experience. And then also looking to see who are we serving. So for example, if we're having a park program and it's a program that is sort of available to community and being used throughout the community, really looking at that data to see how many members of our BIPOC community are participating in those programs, how many members of our BIPOC community are being served by those government programs that we have in place, and really making sure that we're being equitable through our services and also where our funds are going. Additional things to think about here is making sure that staff is aware of community racial disparities impacting their work. And so by doing this, staff will be able to begin to think through and automatically really capture and notice those opportunities to advance racial equity. And so this will work in tangent with utilizing the racial equity impact assessment. And the true goal is for staff to be able to notice those things and act on those things as sort of a nature process or common process. In terms of how do we do this, right, and what are our performance measures, the focus is that we mitigate those disproportionate impacts and racial disparities. We look at the number of staff who are utilizing a racial equity impact assessment. We look at the number of improvements made to the design or implementation of service and programs. One thing that's important to note here that using the racial equity impact assessment is not enough, right? We have to utilize that and actually make changes and do things differently. And so we'll both be looking to see who's using the assessment, but also what changes have been made as a result of that assessment. And then also looking at the number of departments who are tracking service data disaggregated by race.
Council, any questions on equitable programs and services? Councilmember Coulter.
Thank you, Mr. Mayor. And I guess to begin with, I understand that I'm not going to tell you anything you don't already know, but I think we need to be very clear, very explicit that, when we, excuse me, when we talk about equity and programs and services, that it's not just reactive, that we are proactively working to address racial equity issues. And and I think, one example that I have come back to a lot, and I think you and I have even talked about this, Faith, is, when we are talking about redevelopment, we're talking about zoning and land use and so on, that we are actively taking steps to, when we make those decisions, that we are actively taking steps to address racial equity within the community based on that particular area. So I see what I would say is a lot of reactive language, and I know certainly that's not the way things change, but I guess I just sort of want to emphasize really more to my colleagues on the council that we also need to be thinking about this in a proactive way, and not just as things come forward to us, to city staff, okay, this thing came to us, how are we examining this within a racial equity framework, but also what are we as council members, what is staff pursuing on their own to advance racial equity. So I'm wondering, Faith, if you could talk a little bit about what that looks like in the context of this particular focus area.
Ms. Jackson.
So Mayor Bussey, Councilmember Coulter, I'll start by saying everything that you said is important and accurate. Reacting to those things that come across our attention or that we are aware of is one way of advancing racial equity. But in order for us to reach that goal of being the city where people are able to be healthy and thrive across all racial demographics, we won't get there by simply being reactive. And so I won't add more to that because I think Councilman Coulter did a good job of articulating why that's important. In this particular component of my presentation, where we're talking about the racial equity business plan as a rapid response measure, many of the things that I'm highlighting here are reactionary. One, because they build on sort of plans that are used in other places and things that we know that we can do to advance the work, right? But we're just not doing at this time in Bloomington. But later in the presentation, I will give a high-level overview of how we can start to build a strategic plan for prioritizing racial equity and really bringing together the broader scope of equity inclusion and combining that with racial equity. And in that high-level overview of how we develop a community-informed strategic plan, I'll be able to share with you some thoughts around, how do we be proactive and think about, what are the things that we need to do right now to create that future that we want to have.
Thank you.
Councilmember Nelson.
Yeah, thank you, Mayor. Just a couple quick questions in this area, or kind of maybe one general question. And the answer to this may come later in the strategic plan discussion. But what I look at this is these are a lot of the programs and services that we use to serve the community. And when I look at the goals here, they're still very city or business oriented as opposed to community oriented. Like I don't see a goal for any of the measurements within our city survey for home ownership percentages, for percentages of individuals or families that are in a position where they can't afford rent. They're over the 30% rental, so they're burdened on that. I, I guess my question is, all of those community things that we want our policies to impact, how do we measure the impact of those policies within this plan?
Ms. Jackson.
Mayor Bussey, Councilmember Nelson. So I will touch on that a bit as we move forward in the conversation around developing a strategic plan. But I'll say now that my thoughts around how we build that strategic plan is really looking at where we have disparities in our community. So in the area of housing, all of those different things. So we have community engagement, the criminal justice system, all the areas where we know we already have disparities, and that being the luncheon plan for developing our strategic plan. And so the strategic plan will focus on, how do we address those major disparities in our community, and how do we connect the work that we're doing to actively eliminating those disparities, which ultimately is what we're seeking to accomplish here.
That's great to hear, because I think that's all of our shared goal, and I think the city being a leader in measuring its what it's doing in its practices and things is important, but we also do have an impact on the community, so I appreciate that. I think that's all I wanted to know now. I'll look forward to the discussion later, so thank you.
Thank you, Councilmember. Ms. Jackson, let's press on.
And so our final focus area in the racial equity business plan is authentic community engagement. And so here the goal is to increase the racial diversity of advisory boards and commissions, and really authentically engage all residents. This is important because we need to hear from all residents in order to encourage that exchange of different perspectives. And it's also important that we engage residents and that they're fully engaged throughout the various stages of the public participation process. And so by ensuring that we're hearing from community early and often, we'll be able to start to do that work that really allows us to tackle those disparities. And so here, the strategies to do that is to be proactive in creating recruitment and retention measures for our advisory board and commissions. And so this is looking to do things like have interviews for those applicants who are applying for boards and commissions, really encouraging and integrating language that requires racial equity as a competency for those who are sitting on our boards and commissions, and being intentional about how we recruit for those positions, and doing that in partnership with those community organizations who already have trust within those communities. Also tracking our community engagement survey responses. And so when we're doing things, different departments have their ways of doing community engagement, and we're really good about, having a list of these are all the things that we did, and these are all the places that we went. But tracking the participation in those community engagements and disaggregating that data by race. So that if we say, we had 100 touch points with the community this year, we can speak directly to what was the representation of our BIPOC communities in those 100 touch points. And then this also really requires us to invite critique and report progress. One of the things that I speak about often with staff is that in doing this racial equity work, essentially it's my job to highlight all the things that we're not doing right, and really guide us into making sure that we're moving the work forward. And so as we move forward with this model of an authentic community engagement, it requires us to invite critique from community and not to shy away from those tough conversations, regardless as to what format that they're received in. And then also to report out to community the things that we're doing. And so if we are making progress, then we should do that. But if we acknowledge that there are opportunities for improvement, we should also share that share that information with the community, and really not shy away from answering tough questions and doing the work that is challenging. And so here, when we think about what are the success measures, or what are we looking to see, are we on track? Really looking at the composition of our boards and commissions, looking to see which departments are utilizing the community engagement toolkit, and then also looking to see, look at those results of the community survey. And so with the community survey, this would require going sort of beyond what we're already doing and being intentional about reaching out to our BIPOC communities in Bloomington and hearing from them what their experience is like as they're interacting with members of our workforce and those people who they interact with on a daily basis. And then tracking that information and hearing from community what are the things that they think we should be doing differently in order to make their experience more equitable and one that we can be proud of.
Council, questions on authentic community engagement?
And so if there aren't any other questions, at this time I'll go into a review of how I plan to engage community in reviewing this plan and sort of next steps in terms of bringing it back to council and also implementation of the racial equity business plan. And so what I'm proposing is that we do several weeks of intensive community engagement with the plan as it is and invite the community to mark it up, to add those things that they think need to be added there, and to give feedback and suggestions on the racial equity business plan as it is. And in that process, we'll really be centering the voices of our BIPOC communities and thinking about how we can utilize and be innovative and creative and utilize the city's outreach and engagement vehicle to meet people where they are. So this is taking that vehicle either to a store, right, in a racially diverse neighborhood, or taking it to an apartment building. And in order to accomplish that, we'll have to work with our public health leadership and our risk management teams to understand, is it feasible to do that within the context that we're in? And if not, then thinking creatively about how we can provide virtual opportunities for those folks who are most impacted by racial inequities to provide insight on this plan as it is. What I'm also proposing, and this is a request to council, is that each council member host a listening session, invite the community members within their district to a listening session. We'll all present sort of a high level overview of just the racial equity business plan, and then hear from those community members about what are the things that they think are important, or what are things that need to be added, what things need to be changed, and just take in that feedback. And so that would be a request for the council to work in collaboration with both myself and respective community engagement division coordinators to set up those meetings. And in doing so, if we're able to get everyone to participate in that process, we will have had a listening session in each council district. And then we'll take that feedback that we've received and incorporate it, right? So again, thinking if there are things that are reactionary or are responsive that we can immediately add into the plan, do that. And then I'll return to the council with a request to adopt the racial equity business plan. I also will return to the council with a request to define the process for ensuring accountability. And so you may have noticed while the plan is fairly thorough and talks about goals and needs and strategies and sort of metrics for identifying success, what's noticeably missing from this plan is how do we hold staff accountable for doing this work? And so this is a question that I'll pose to the council. And when I come back with the sort of request to adopt the plan, ask the council to give guidance on how do we hold staff within the organization accountable for actually implementing the things that we've listed off in the racial equity business plan. And so I'll end here with just a couple of frequently asked questions that come up when I talk about the racial equity business plan. And so these didn't come up in this discussion, but I'll add them nevertheless. And so one of the frequently asked questions that comes about is, why do we focus on race, right? And so we know that throughout history, government has created and perpetuated racial inequities, and that our BIPOC communities fare worse than their white counterparts in areas of life when it comes to societal outcomes, right? And so while the city is mindful that there's a wide range of equity issues deserving attention, we lead this discussion with race. And so it's race and as opposed to race only. Another frequently asked question is, why are we responsible for racial disparities we didn't create? And so building on the commentary before, right, about government's role in creating
disparities, right, and creating inequities, we also know that the taking of land, labor, and resources has created unlimited opportunities for wealth and stability in America, and many people continue to benefit from that today. And so, in order for us to really move the dial and move the needle on this work, we have to move beyond thinking about the individual and intentional acts of discrimination, and really examine the systems in which we live, which also includes the work that we do, and think critically about how do we begin to eliminate those racial disparities in our community, whether they were created unintentionally or intentionally. And then lastly, another question that comes up often in presenting the racial equity business plan is, as we think about diversifying our workforce, how do we ensure that we do not hire less qualified candidates? And so the response here is that first, we strive to eliminate those type of questions from the conversation. On the onset, it may appear harmless at first, but we know that these questions are a byproduct of these societal myths about the competencies and abilities of racially diverse groups. And so this idea that as we diversify our workforce, we're going to somehow lower the quality of hire is just misinformed, and it's a fallacy. And so, in addition to right, like we have legal requirements, and the city will not make any hiring decisions based on race. So those are some of the frequently asked questions that I offer up here. And because we've taken time for questions throughout each point here in the racial equity business plan, I'll pause briefly just to see if there's any questions about anything I've said at this point before moving on.
Any questions, council? And I'll say I don't have any questions, but I thought it was an outstanding presentation. Appreciate how you brought so many different elements together and brought them together effectively. It's all tied together. The world that we live in today, whether it's the pandemic and its impact on different communities of color, the pandemic and its impact on earning and being out of work and the need for assistance, and how it all ties together with the different work we've done and the work we're hoping to do as a community, and the earlier discussion we had on police use of force. I mean, it all ties together in so many different ways, and I think you've done a nice job of kind of integrating and weaving those through, and I think that needs to continue to be our discussion as we move forward. We need to keep all the different pieces in mind here, and it's not. I mean, you use the phrase it's race and I mean it's race and many things, and I think we need to keep that in mind as we move forward.
Thank you, Mayor Bussey. If there aren't any additional questions, I'll keep plugging along here in the presentation. And so at this time, I want to move from talking about those rapid response measures and sort of those things that are reactionary, right? That we know either through best practices that we can start to do and see change, and really have a conversation about how do we reimagine what's possible. And so what I'm proposing here, Council and Mayor, today is that we utilize this model, and we've talked about this before, and Mayor, but so you've mentioned that as a city of Bloomington, we're committed to listening and learning and moving forward. And so what I'm presenting to the council today is an opportunity for us to have a phased approach and be really intentional about reimagining the future. And so while we're addressing those urgent needs through our rapid response measures, we will simultaneously be committed to allowing the community to imagine what's possible, and create their future, and that future that we want to see. And so when we talk about reimagining what's possible, this is really an opportunity for us to utilize community testimony to address the root causes of inequities. And so I mentioned earlier today that when we shifted to the conversation of strategic plan, that the foundation of that strategic plan would be looking to where do we have racial disparities in our broader community, whether it's an issue of jobs, income, housing, education, all of those sort of broad areas throughout the community. The strategic plan will be guided by looking at where we have racial disparities and really thinking about what is the work that we're doing And how are we able to address those root causes? This strategic plan, it requires bold thinking, right? And so this is about us being unconventional or really stepping into bold thinking here. It requires unconstrained creativity, right? And really allowing us to use our imagination and think about those things that we haven't thought about before. It requires innovation. It requires the transfer and also the sharing of power of community, which traditionally is not something that government has done or definitely hasn't done well, right? And so this really requires us to give up something and really transfer and share power and allow community to provide an agenda for us to carry out, as opposed to the inverse of that. It requires sustained commitment, right? And so when we think about a strategic plan, right, this isn't something that we're going to complete in 1, 2, or even 3 years. This requires a sustained commitment to the work, both from the organization leaders and also the community members who will help us design the strategic plan and implement the strategic plan. It also requires regional partnership. And so one of the things that's, I think has been mentioned before, I've mentioned this before to the council, is that when we think about addressing racial disparities, right? So let's just say we're looking at jobs or income. The way there are ways that the city of Bloomington and the work that we do can impact those things, but we're not directly responsible, right? And we don't necessarily have the ability to create those changes and tackle those root causes on our own. And so this regional partnership is really thinking about how do we work with county agency, how do we work with state agency, how do we work with community stakeholders, how do we work with the school district, how do we work with businesses, faith-based communities, all of those different community partners to develop a plan that advances racial equity and really pulls in those other things. So I talk about race and this strategic plan will look at sort of gender diversity, disability awareness, and making sure that we're really pulling in that larger range of equity issues and prioritizing that work. And then it also requires the understanding of limits and legislative authority. And so while bold thinking and creative measures are important, the reality is that we do have limits to what we can do as an organization. And there is legislative authority that governs the work that we do as a city. And so that is an important part of this work as well. But it's listed here on the bottom, particularly because in this process of creating a strategic plan, we're thinking about starting from yes. And so we start with, we hope to do this, or, you take in all the ideas, and then you balance that against sort of limits and legislative authority. But the goal here is to really, on the front end, be creative and taking in all suggestions. And so, as I mentioned before, today I will provide just a very high level um, approach to what this could look like. And I will hope that the council will invite me back at another study session after we've begun to implement some of those rapid response measures to really think about how do we implement this approach. But I see this as a three-phase process. And so in phase one, we stop talking and we listen. And here, when I talk about listening to community, it's not just having a community session, hearing from people, taking notes, and then saying, yes, we did this. This is listening to understand. This is listening to understand and believe the experience of our community members, and also listening with the intent to take action on behalf of what we've heard. And so we'll put together a series of listening sessions that are coordinated in partnership with our strategic partners and center the voices of our BIPOC communities, understanding that this is not work that we are doing alone, right? And that there are strategic partners that need to be involved in this process. And these listening sessions will bring opportunities for us to have innovative spaces that allow for creative ways to engage. And my suggestion is that we have different topics for each listening session and that we have different methods of conducting these listening sessions, whether it's in person or virtual, and using tools, using games and technology, really thinking creatively about how do we reach all segments of our populations, how do we reach people of all ages, understanding and that the youth are part of our future workforce and the people who will be living
in Bloomington in the upcoming years. And then those equity topics will really speak to the areas where we have racial disparities. And so there will be a topic of discussion for housing, or a topic of discussion for jobs and incomes and wealth attainment and business development, all of those things that really focus on that broader community work. I'm also suggesting that we create multi-generational work groups. And so in having a conversation with my mentor a few weeks ago, she mentioned something to me that I thought was particularly powerful. And she suggested that as we engage in racial equity work, and this was a sort of suggestion for people doing this work generally, that we take the time to really listen and hear from those people who've been doing this work for a really long time, right? And understanding that efforts to advance equity in our community and in our country are not necessarily new. And so really looking to see, who were those people who chartered the Bloomington Human Rights Commission? What were their work plans 20, 30 years ago? What are the things that we've accomplished? What worked, right? What hasn't worked, right? So that we're not recreating the wheel, and that we're also not making mistakes that are self-inflicted. And so we would bring together those people who are new to the work and have that passion and excitement and motivation, and work collaborative with those who've been doing this work for a really long time, who have that wisdom to inform where it is that we need to go. In phase two of this process, we'll take what we heard and begin to brainstorm solutions. And so this will be an opportunity for us to work hand in hand with community and policy experts to take what we heard and really begin to develop a strategic plan. And this process will take some time, and it will require many drafts, right? Will require us to balance the ideas that we've heard from community against that legislative authority and our limits. And this work will be led by our department leaders. And so one of the things that I failed to mention before is that for each phase of this plan, there will be a group of executive leaders from our ELT who will be guiding each phase. And so who will be personally responsible for making sure that these phases are carried out, and that we're able to move throughout and develop the strategic plan at the end. And then here, one of the things that will be important is us utilizing the resources of those people who are experts in their field. So really looking across the country to see, are there people who can come in and help us dig through our data or understand some of these community issues that we're having? Are there organizations across the Twin Cities that we can partner with who've already done work to analyze racial disparities in housing or racial disparities in jobs and things like that, and really bringing in those people who have um, that specific expertise to guide the work. And then the last phase of this strategic plan process is where we start to act. And so we will begin implementing the strategic plan that allows us to embed racial equity in all our programs, policies, and practices, and also unite the broader focus of our equity and inclusion work. We'll also track our progress, evaluate actions, and it is, of course, always inviting critique. One of the goals for this work is that it's community driven and community informed, and done in collaboration with experts who really understand the nuances of some of these issues, so that we will have sort of the best plan that we can create. Um, Even still, right, it's important that we continue to evaluate that, and that we invite critique and understand that these issues may shift with time, and we need to be receptive to those changes. And so I'll describe here briefly sort of what an implementation and evaluation process would look like for this strategic plan. So each phase will have an ELT lead, so a member of the executive leadership team will lead each phase of, sort of building this strategic plan. But we'll all work together, right, to develop it. And when I speak about we'll all work together, that's including, all staff within the organization, and of course in consultation with the mayor and council. Community voices will share equal weight, right? And so when we're gathering those ideas from community about what it looks like to align the work that we're doing, the suggestions that community brings forth will be just as important as the suggestions that we hear from our policy experts and the suggestions that we hear from leaders within the organization. Evaluation is ongoing. This is a multi-generational project, right? and really thinking about equity broadly. It's making sure we have representation from various genders, ages, different ability statuses, and it will build on the wisdom of pioneering leaders, right? So that we're not recreating the wheel, but we're really picking up the work where others have sort of carried us to the point and thinking about how we build that out. And then it will also align with the work of other community and regional partners and agencies. So looking to see what are the things that are the school district is doing to advance issues of equity and inclusion. What are the things that Hennepin County is doing to advance issues of equity and inclusion? Or what are the things that are happening at the state level and working to align our work with all of those different things. And then we'll repeat this process as often as needed until we get where we need to be. And then also just remembering that the rapid response model will always be running in the background. And so while the strategic planning process will take some time, right? And it's a significant investment and it requires us to slow down and be intentional. That doesn't mean that we can't continue to address those urgent needs. And so, in the end, as we build this bridge to the future and we think about how we listen and learn and move forward, we'll be becoming that place that is vibrant and safe and healthy. And I like to envision this, right, as a starting place. The rapid response models are sort of where we are right now. And as we're crossing this bridge and sort of building in this work and developing the strategic plan, we're really looking out into the horizon and seeing how can we be that city where community voices are heard, there's authentic engagement, there's housing security, there's safety, there's police reform, people are healthy, youth are leaders, and there's also that transfer and understanding of power. And perhaps most importantly, there's trust in our community. And so I'll stop there to take some questions, and then I'll move into the last portion of my presentation, which really speaks about what are the things that are needed. So what are the resources that are needed, and what are our challenges and opportunities for implementing all the different things that we've discussed here today. But at this point, I'll stop and take questions about the strategic plan and that high-level overview.
Council questions? Looks like none. Onward, please.
I think that's a good thing. It's also 11 o'clock, so and that may be a part of it. But I'm happy to take questions at a later date if needed. And so, in thinking about, all the different things that I've discussed today, right? So the rapid response measures, the things that we're doing to mitigate the disproportionate impact of COVID-19, this new model of a combination of racial equity and community engagement. Of course, the implementation of the racial equity business plan, which is a significant list and has a number of different strategies embedded in it. And then also the simultaneous building of the strategic plan. These last few slides really speak to what are our opportunities and challenges in being able to do this work. And so one of the things that we have as an opportunity is community demand. And so right now there's a sense of urgency for community for us to move forward in this work. And with that demand, there are people who are stepping up to say, I want to be involved, right? And so I've received a number of emails from organizations and individuals who are saying, let me know what I need to do to move this work forward. There's also urgency within staff. And so as I've received sort of emails and messages from community members about being supportive of this work and wanting to be involved, I've also received those messages from staff. And staff is really looking for a leadership to help them and guide them in doing that work. There's also the ability for us to utilize technology to connect, right, which is a barrier in some cases, particularly for BIPOC communities, for those people who don't have internet access. And also sort of the inverse is that it sometimes can be used as an opportunity, right? So instead of having to fill up your car with gas and drive over to City Hall for a community engagement meeting, you can do that from the comfort of your home. Also, we have partnerships, and we're starting to work collaboratively on a regular basis with some of our community stakeholders like VEEP and the Bloomington Chamber of Commerce, OASIS, Normandale Community College, and the Bloomington Public School District System. And so these partnerships that the city manager brought together in response to COVID-19
will be important partnerships as we move forward in this work. The other opportunity is that we have leadership who is ready to listen and learn and move forward. I mentioned that these words have been sort of front and center in many of the statements from the mayor in the recent weeks, but they've also been things that we've heard from our department leaders. So we've heard from our police chief and our fire chief and many other department leaders who have said, you know, I'm willing to listen, I'm ready to learn, and I want to move this work forward. And so I'm an optimistic person, generally by nature. So I started with the opportunities, but there are also significant challenges as we try to move on any number of the things that I presented to you today. And so we have centuries of unresolved racial inequities. We have a very real mistrust of government. And there's also people who are frustrated with broken promises. And so right now, the community is looking for more than lip service, and they want to see us do things differently and really show up in that way. There's a lot of racial trauma in the community right now, and a lot of perceived hopelessness. In some of the listening sessions that I've been involved in, we've heard from members of our community who say, you know, it was really difficult for me to participate in this conversation because honestly, I don't know if it's going to help. And there are people who've sort of resolved to just not even engage government because they've had so many broken promises, and they've sort of resolved to hopelessness. There's also the pandemic, right, which is having a disproportionate impact on our BIPOC communities and sort of inconveniences the way that we interact and engage in a number of ways, which includes the limitation on gathering and connecting in physical spaces, which we know is a best practice for engaging community. There's also a housing shortage in our community, and there's also a lot of job insecurity. And so when we think about, you know, we really want to engage those people who are most directly impacted by racial inequities, they have a lot on their mind right now. And so when you're thinking about how you're going to be able to pay rent or, you know, are you going to get another job, you may not have a lot of time to prioritize coming to a listening session and talking with government leaders. And then there's also the staff capacity. Right now, so the responsibility for building the racial equity plan and sort of implementing that work and sort of the strategic focus for racial equity work is housed in one person. And I don't have staff that I can work with to really move this work forward in a way that's quick. And so we are sort of limited to what we can do within that capacity. And so while originally there were intentions to grow that work out and align the work here in Bloomington, we also have the challenge of budget restrictions. And so we have to think strategically about how do we get this work done, right? And where do we find the capacity and how do we have resources invested in this work while balancing a number of different things. And so I'll end by saying that, you know, there are some significant challenges to moving forward on all the things that I spoke about tonight, but there are opportunities, and I remain committed to doing what I can to move this work forward. And so I'll pause now here for the final time to take any questions on any of the things that I've presented here today, and then that will conclude my presentation.
Well, thank you, Ms. Jackson. A lot of good information there. Councilmember Lohman and Councilmember Carter.
So just real quick, I noticed on there that for the challenge standpoint that you mentioned around staff capacity, and it's just something I wonder if the council, and maybe it's such a late hour, it's not the time to talk about this, but I know that we have put our priorities around our strategic priorities, and we've tried to, you know, that's something that I know that our budget subcommittee is going to also be looking at those types of things. And so, in the way that you put this proposal forward, you have mentioned how this will ensure that we are strategically aligned for our future. And so when I look at that from a sustainability long-term standpoint, I think we need to consider that staff capacity and budget restrictions in terms of those that lens as we look at that. But this is important work that needs to be done. I don't I'm not saying that we need to. I'm saying that I'd like to at least have the discussion, Mayor, and have a conversation about what that means and how this gets operationalized when we look to the future.
Thank you, Councilmember Lohman. I would agree with you. It's a conversation that we definitely have to have. I don't know if here and now is the time to do it, or if it's more in the context of the work being done by the Community Budget Advisory Committee and some of our budget discussions as we go forward, and then some of the overall priorities and putting together what the future looks like. Because you're exactly right. I mean, this is a strategic priority, and we have talked about it at length, and the staff capacity likely is an issue, and the budget realities are an issue as well. So definitely something we need to talk about. I don't think we're going to solve it here tonight, right this moment, but definitely something that we have to keep in the forefront.
I think you put it well, Mayor. I was looking to solve it here tonight, way too late, but yes, thank you.
Councilmember Carter.
Thank you. So I guess I just wanted to say that, I want to echo what you said, Ms. Jackson, and that I am 100% committed to seeing this work happen. And I think it's absolutely critical. It's, if not one of our top priorities, the top priority in terms of making sure that we're moving forward and making sure that we have a city that really is truly equitable and inclusive for people of all backgrounds. And so I appreciate you bringing up the accountability piece and being explicit about your ask to council and your request for us to kind of figure out what that can look like or should look like. And then echo what Councilmember Lohman and Mayor Bussey said about, resources and support to really do this work. And of course, there are challenges there, but needing to figure that out. And I guess I think about, the resources and support, but then also what are those policies and systems that we need to make sure are in place in the long run for this work to really be institutionalized and sustained, beyond all of our times here. And just looking to see if I had any other. I think those were my key points. And so I just want to thank you so much for all of the work that you've been doing, not just on the creation of this plan, but just broadly. I know that we've been asking a lot from you, at least from my perspective. And so I just hope you know that we all see it and that you are an incredibly valuable person and employee of the city and all of the work that you're doing is really incredible and I just want to thank you.
Thank you, Councilmember Carter.
Councilmember Coulter and then Councilmember Nelson.
Thank you, Mr. Mayor. So the first thing that I want to bring up here is that I think and this gets to a number of things that you spoke to tonight, Faith, but that as we sort of just as a reminder for all of us, I think as we continue this work, that we are not only engaging community members who are already supportive of this work, as important as that is, but I think as elected leaders, as leaders of the community, we need to be clear that part of our job is to sort of bring the community along with us as we do this work, and to recognize that some folks will not necessarily always see the value in this work, and some folks will frankly oppose this work. I think it's safe to say that there will be folks who oppose the work of racial equity in our community. And so I think as we as elected officials and as staff who are leaders within our community continue forward, that we need to be clear about that and acknowledge that and develop strategies to address that. And so I kind of just wanted to put that out there. And then I won't repeat everything that Councilmember Lohman said, but Faith, I think I have referred folks to you more frequently over the last few weeks than just about any other staffer working for the city of Bloomington, and that includes the city manager. So I think we absolutely need to talk about resources and what capacity we have to do this work, because I think we're only seeing we're seeing every day that this work is just getting bigger and bigger and more important and more important. Um, and I think it's more than fair to say if that is more than we should expect from one person. Um, so those are just my thoughts.
Thank you, Councilmember Coulter. And I won't go into details here because it's of late in the hour, but there are parts of both the racial equity business plan and then thoughts that I have for the strategic plan that really looks at how do we bring community into this work, and then how do we start to move people along the continuum. And so I recognize that, preaching to the choir is not going to get us where we need to be. That's important. But we also have to start to engage other people in the work and really build on those learnings and understandings. And I'm happy to type up some of those things and send it over to the council as an additional attachment to this presentation.
Councilmember Nelson.
Yeah, thank you, Mayor. I just have two things. First of all, Ms. Jackson, thank you for all of your work. It's significant and important, and appreciate it. And I'm happy that the city has been working on this for a while, that this plan was before us in March, but I'm also very mindful that a lot of the urgency around this conversation came from a very tragic event, the killing of George Floyd, which has led us to multiple conversations with our police department. And I guess I'm just curious, as the racial equity coordinator of the city, if you have any thoughts or things that you think that as a council we should be looking at, other people we should be talking to with regards to the conversations we've been having with our police department. I will just say that I'm very impressed by our police department, the information that they have provided. I also think it's important to hear from those in our community that may not have had ideal experiences with them, and see what we can learn from that. Again, today we got a lot of data. That data looks really good and informative, but you're in a position and extraordinarily knowledgeable about this. So I just want to ask, what are your thoughts about the conversation we're having, and do you have any input that might help us as we look at these things?
Ms. Jackson, any thoughts?
Mayor Bussey, Councilmember Nelson, I'll start by saying that one of the things that I have mentioned to our Chief Potts over the last several weeks is that what's really important for us during this time is to really focus in on those needs that the community are bringing forth. And so as we're thinking about making system and structural change, that we do that with the input of those people who are directly impacted. And so in those listening sessions, we've been tracking what the community is sort of identifying as their common concerns. And so I can work with Chief Potts to send that information sort of in a written format to the council members who haven't been able to participate in those listening sessions, and really think about what are those key things that the community are asking for in terms of systematic change and changes as it relates to law enforcement in the area of policing. To your question regarding are there other things that we should be thinking about and things that we should be doing, I think that there are a lot of models to look to across the country and across the state. And the city is connected to things like the National League of Cities, and they have the Real Council. And the Real Council, I think about 2 weeks ago, pulled together a report for a bunch of strategies and suggestions for the cities within the National League of Cities to do, right? That are very specific to issues of community policing. And so that's just one example of a resource that we're able to take advantage of already. And so again, I'm happy to pull together some information about additional resources and maybe do some research around what things cities are doing in the efforts of like police reform and community policing. But I think the most important thing that we can do right now is really hear from those folks who are in Bloomington and say, what are the Bloomington issues that we have, right? And that doesn't mean that things that are part of the national conversation aren't important, but we just don't want to lose that touch point with community and really allow them to drive the strategies that we're engaging in. And so I hope, Councilmember Nelson, that answers your question. But if not, please do send me your question in the email form, and I can spend some more time to think about it and think through it and provide a response that I'll copy the council on.
Actually, that does answer my question. I appreciate that you're working and helping lead some of the efforts with the police department and our co-ed division to have those conversations, get that input into this process, listen to the community, because I think those are voices that we absolutely need to hear from in this conversation, and not just talks amongst ourselves and think that that's enough to address the issues. And I'm not trying to say that that's the position of anyone here. The other thing that I'd like to just add to the conversation, and I think this will come out in the plan, but you know, the sad reality, as you know, we heard from kind of the setup to this evening in the video, that you know, Minnesota's great. It's number one in so many things, unless you break the data down by race. And once you do that, you know, candidly, we suck. And we have for a long time. And, you know, we've had a lot of people in my position in the political world talk a lot of good words and say a lot of good things about doing things. And I want to make sure as we do this that we support you in getting real meaningful change in our community to make progress on these issues, you know, in a way that actually helps the people, the residents in our community, achieve their aspirations. And so thank you very much for your work. It's, like I said, it's extremely important, probably some of the most important work we're doing. So thank you for your help.
Thank you, Councilmember Nelson.
Councilmember Martin.
Thank you, Mayor. And thank you so much, Faith. I echo all my colleagues here, but just say briefly to come into a new position.
Councilmember Martin, we're having trouble hearing you. Is your microphone tied up somewhere, or?
Up on top of my head.
There it is.
I've only been doing this for a few months now. Yeah, just briefly, thank you so much to be coming into a new position like this, to really make it your own, to work cross-departmentally, and be making so much progress in the community at such a tumultuous time. I think is incredibly impressive. So thank you for all this. And just to underscore a point that Councilmember Nelson brought up, when Mayor Bussey and I were on the call with leaders in the Black community, something that was really a gut punch for me was when one of the participants noted, you know, I reached out to a lot of other folks and I heard back from some of them, you know, why bother participating because nothing's going to change. So I really love this dual approach model you're putting forward here, where with the rapid action, we can move forward on actionable items and report back to the community on that to start building some trust so that in the more robust, say the multi-generational conversations, the district by district listening sessions, as we're proving to folks that we're listening and we're working, hopefully that feeds into momentum on the other side of that bridge as well. So I also just wanted to thank you for that nuanced approach, because I think all of this success is going to be riding on the center of that structure.
Thank you, Councilmember Martin.
Anyone else? If not, I will just add my thanks, Ms. Jackson, for your hard work on this and for the great work that you've been doing over the last few months. Well, actually, since October. It's been since October already. It seems, it's hard to believe that it seems like yesterday and it seems like a million years ago at the same time. I'm not sure how. So, but thank you for your work. Thank you for your efforts, and thank you for your leadership on this. And we'll, I'm looking forward to continuing this discussion and this work between you and the City Council. So thank you very much.
You're welcome. Happy to do the work.
Mr. Manager, anything else to add on this topic?
On this topic, Mr. Mayor and council members, no.
Then I will say good evening to Ms. Jackson and call item 2.4, a City Council policy and issue update. Mr. Manager.
Mr. Mayor and council members, the only item to mention, I think council is aware that the legislature has reconvened again in special session beginning today at noon, and they have recessed, and I think for several days. It seems that there is a potential global deal that is pending on bonding and taxes and some disaster relief and other important issues. Police reform is also on the table. It sounds like they're going to take somewhere upwards of perhaps a week to work out all the final details, but I think everybody is sounding and feeling a little more optimistic this week than they have in the last couple of months, so I'd say that's progress.
Council, anything to add? Any issues to bring up? Councilmember Martin?
Thank you very much, Mayor. Two real quick items again with an eye to the clock here. Just first of all, throw out there for council consideration. I think I would like to take a look at sunsetting our use of these vascular neck restraints. And to be clear, and this is in non-lethal use of force situations. To be clear, I don't mean chokeholds. It sounds like we're not using those in non-lethal situations now. I mean, using pressure to someone's neck to prevent blood from getting to their brain and knocking them out. I guess just kind of my 2 cents. I get that when it's properly applied, it's safe, but that's also kind of like saying, well, 90% of the time it works every time. And even data that we've gotten from folks in our policing community has shown that when it does result in injury, it's as likely the officer gets hurt as the suspect that the technique's being applied to. And as we've seen, it's for that reason, most major law enforcement entities in the state have sunsetted this, many of them decades ago. Post board doesn't advocate for it. The police academies don't train for it. And I get that we'd be removing a tool from the toolbox, but it's a tool that nobody else wants to use at this point, outside of us and maybe a handful of other entities. So all that to say, I understand a lethal force situation could be very different, and different standards would apply there. But short of that, I'm not sure why our department needs to continue standing alone in this technique that most other cities in the state are getting along pretty well without. So just throwing that out there for my colleagues. And also, I appreciate that the city manager had shown a willingness to have another item at a future meeting talking about specifically lethal force and had asked about kind of parameters on what topic areas should be there. I would advocate for that and just say I'd be really curious to know a little bit more about. It seems like a lot of our definitions around things like objective reasonable force apply really only to whether lethal force is justified and to what extent of kind of physical force is justified. But a lot of our standards around de-escalation and when de-escalation would be appropriate seems a little squishier. So I'd just be curious to learn a little bit more about where that line is, because I'd like to try and move towards a system that better qualifies use of deadly force or use of extreme force as a last resort, and then codify that in very firm language. So kind of knowing what legal precedent is set and where that line is between determining where de-escalation is no longer successful or likely to be successful, and how in hindsight we could look back to determine if officers correctly judged where that line was before they decided to escalate situations. So that's kind of what I'd like to see at a next session on this if we can get there.
Thank you, Councilmember. Others? Seeing no one, I'll just add very quickly and then we'll get out of here. We are in Monday number 2 of 9 straight Mondays together. So thank you for your work. Thanks for sticking it out to the late hour and the great conversation again tonight. And just to let you know, it's going to be, we've got 7 more and we're taking some meaty bites here on some big issues. And I think we're doing a good job, but I want you to keep moving forward and keep your eyes looking forward for a lot of different reasons. That this can get overwhelming quickly, and it can become too much very quickly, I think. So we aren't there yet. I don't believe that this group is there yet. I believe we're all pushing forward and doing the good work that needs to be done, and I know that we can continue it. But just make sure you take care of yourself physically, mentally, emotionally, and we keep moving forward on the things we need to get done. So well done so far. Thank you much. Seeing nothing else, Council, I would very much welcome a motion to adjourn.
So moved.
We've got a motion in a second. Ms. Christensen.
Sorry, I didn't hear who made the motion. I heard Councilmember Carter as the second.
I think it was me.
Let's go with Coulter.
Okay, thank you.
Yeah.
All right, thank you. Beloga,
Aye.
Mayor Bussey,
Aye.
Carter,
Aye.
Coulter,
Aye.
Lohman,
Aye.
Martin,
Aye.
Nelson.
Aye.
Motion carries. We are adjourned. Thank you all very much. Have a good night's rest.